has 16,000 responses. I'm about to weigh in on this, react to what people are saying. Are you ready? I'm ready. Bear, are you ready? Be-woo! What do I want people to know about their body? You need 7 to 9 hours of sleep as an adult. I don't want to hear people say that they think they function better on 5 hours because it's just not statistically or scientifically true. Superman, Wonder Woman, you still need 7 to 9 hours as an adult to be healthy. On average. Antibiotics only work against bacteria. They're not some kind of wonder potion that cures anything. They shouldn't always be given. I'm sick right now. I know that statistically 90%, 80% of the time this is viral. The fact that I'm getting better slowly, my fever is going away, it's not bacterial. If all of a sudden my fever spikes, then I'm gonna go and get some antibiotics because I know I'm getting a bacterial superinfection. Most of these are viruses. And if your doctor gives you a once over, does a proper history and physical and tells you you don't need antibiotics, don't force their hand. You're only doing a disservice to yourself. Tell us what drugs and alcohol you're on. We aren't gonna tell the cops, we aren't gonna lecture you, but it might change the anesthesia I give you. Some stuff I give you might kill you. If you drink a 30 pack a day, tell me. Okay, this goes into the whole idea of patient confidentiality. So first of all, if you tell your doctor something, no one else in the world is gonna know about it unless you give us the rights to share that with that person. There is a lot of drug-drug interactions that we wanna avoid. Very commonly, at least in my line of work, what's happened is a patient, I can sense, or I know they have a history of cocaine use, and if you give a medication as a beta blocker, which you give to slow the rhythm of the heart, improve circulation to the heart after a heart attack, you don't want to give these two medications together. So when patients come in, I ask them, tell me what drugs you've taken, tell me what you've been taking most recently. They get all nervous thinking I'm gonna call the police. That's not what we're asking for. We're asking for to make sure to give you the best possible care. When we ask you your last drink of alcohol, it's that so we can avoid a condition known as delirium tremors. It's a very dangerous condition that can lead to seizures and even death. Trust us, we're looking after your health, nothing else. There's a wide range of normal. Don't be embarrassed by your body. Having said that, if you're concerned about anything, ask your doctor. We generally have heard it all before, and trust me, we have nearly always seen it all. Maybe you have something that has been bothering you for ages, but you were too scared or embarrassed to ask about it, so just ask. It might be nothing and you have been stressing about it for no reason, and if not, then you're at least one step closer to getting it fixed. No one can help if they don't know. There are no stupid questions, so ask away. I think this is a really good point. When patients ask me the very simple question of, when should I go see my doctor? The answer is, if something is bothering you, or if it's giving you anxiety. The longer you wait, two things happen. You build up more anxiety about the issue, or two, you can actually make the condition become worse, and progress to the point where treatment may not work as effectively. Some people seem to think that if you act healthy for a bit, it'll make up for being a wreck. There's a lot wrong with this. One example, antioxidants are like gas for your car. You can store up a certain amount of vitamins, but your tank can only hold so much. If you binge and overfill your tank, it doesn't do anything except excrete it as waste, and you can't expect to go the next several months without gas. Just because you're bringing in extra materials that we know you need to maintain a healthy liver, bones, brain function, whatever it is, it doesn't mean that you're actually gonna get better bones if you have more materials. The same way that if you're building a building and all of a sudden I say, well, you know what, instead of giving you the materials you need for this month, I'm just gonna dump all the materials you need for the next year. And now, does the building get built faster? It doesn't. It would help if more patients knew their family history. Prevention is becoming more and more important in medicine, and treating a disease in its early stages is a lot better than catching it late. That's very true. I think that in general, we as a society are not very good at keeping track of our medical history. Many of my patients come in and can be taking 10 medications, not know what they are outside of the color, size, and shape of the pill. They don't know what medical diagnosis they have, which ones have resolved, and they don't no longer suffer with that illness. And then the family history is obviously in addition to that. The more we can stay on top of that and be leaders for our own health, the better outcomes we're gonna have. I beat my meats. Okay, not the greatest name. Don't do DIY surgery or hold off on reporting things that are obvious warning signs. Don't be the guy who tried to remove his skin cancer with a knife. Duh? Yeah, please don't do your own surgery. I have seen some videos online of people like popping their cysts. Stop that. Stop that. Just because you watch some pimple popping videos on YouTube doesn't mean that you're qualified to do that. It looks simple, but there's a lot of things that can go wrong. There could be a blood vessel there that you pop and now all of a sudden you can't control the bleeding. What are you gonna do then? What happens is whatever cyst you took out actually turned out to be cancerous. Now you'll never know because you didn't send it to pathology. Good point, Pete my meat. You need some kind of exercise. Doesn't matter how you feel right now. Sitting for 12 to 16 hours a day will have negative consequences. 100% true. In fact, before doing this video, I contemplated doing a video on the dangers of sitting. That may sound funny, but it's so true. Sitting is like the new smoking, is a slogan that's been used by media companies, and some people saying, oh, it's overblown, it's overblown. The amount of risk is overblown, but the fact that sitting for too long affects your mental health, your physical health, your cancer risk, muscle aches and pains. Stop sitting for 14 hours at a time, playing video games, Netflix, YouTube, all this stuff. Take a break, stand up, go for a walk, get a puppy, go on a date, get some water, go pee. Whatever your excuse is, walk around and be happy and healthy. Your kidneys and liver cheerfully do all the toxin elimination you'll ever need. I love that term, cheerfully. Cleanses and other detoxifying products are BS, woo, and a waste of money. The people who sell them are predators who only care about your money becoming theirs. That's 100% true. As I said in my TED Talk, IKA experts are interested in one thing and one thing only, and it's not slimming your waistline, it's slimming your wallet. That administering CPR compressions as soon as possible is one of the greatest indicators of successful outcomes. You are right, and that's why we say chest compressions, chest compressions, chest compressions. Instead of saying hands-only CPR, I like saying chest compressions, chest compressions, chest compressions, because that's the first thing you should do if you feel no pulse and someone's non-responsive. You'll not only save a life, but you'll be proud that you too have some medical knowledge, can improve this world. Some things just don't belong in your rectum. I would go ahead and say most things don't belong in your rectum. I think some is an understatement there. You often will feel normal even with high blood pressure. It's found incidentally, so don't wait until it gives you symptoms you don't want to go through. Very good point here. Too many of my patients think that because they feel fine, that there's nothing wrong with their blood pressure. It's not something you feel. It's something intrinsically happening that your heart has to battle against. Therefore, you increase your possibility of developing heart disease. And as we know, that's not good. And also strokes. Even worse. Not only should you be listening to your doctor and taking the medications or treatment that the doctor prescribed to you, you should be taking it regularly and consistently. I'm a vet, but I'm sure doctors will have come across this too. Amputated limbs do not grow back. I've had too many people asking me how long it will take for their pet's amputated limb to grow back. So I'm assuming a few doctors out there will have patients asking the same of their own missing limbs. Yeah, limbs don't grow back. If you reattach them the right way, they can heal, but they don't regrow. Ooh, Kofico, your mental health is just as important as your physical health. How did I not give that one to you guys in the beginning? I'm so passionate about that. If you are not healthy mentally, it will reflect in your physical health. Give you a simple example. If you're very stressed or depressed, that can affect your blood pressure. When your blood pressure is high, it causes increased rates of heart disease and stroke. If you're depressed and your cortisol levels are high, which are your stress hormones, it constantly keeps your body in a high sympathetic state, basically a fight or flight state. It doesn't heal well, it doesn't digest well, you don't get nutrients from food very well. You could see how a worse mental state will give you a worse physical state outcome. Believe it. This isn't woo-woo. Just because a part of your body hurts does not mean that part of your body is damaged or out of alignment or needs to be repaired. You can have tissue damage without pain, or you can have no tissue damage with a lot of pain. Absolutely correct, absolutely agree. And the reason why I actually discourage my patients from rushing to get MRIs, here's what happens. If you take 100 people who have no back pain, you scan their backs, meaning their spines with an MRI, you'll find that 70 to 80% of them will have some sort of finding on that MRI. What that finding means is pretty much nothing, because clinically they're pain-free, they can function well. Now, if you take someone who has back pain and then you find one of those findings, then you might be able to say, well, they have this herniated disc, they have back pain, it's probably because of that. 90% of sports injuries, like back pain, do resolve with conservative treatment like physical therapy. So one of my first and foremost treatments that I give to my patients outside of like the home exercise program, osteopathic manipulation that I do, is physical therapy. Do not rush for unnecessary surgery or even worse, unproven treatments, which there are a ton of. Please, if you want some more videos with me and the bear pup, to see how he's doing, like maybe a day in the life bear video.
By the champion, her forehead immediately started swelling up.
Oh, look at that.
Oh, big shot by the champion.
That's a hematoma. And while that looks terrible, it's not as dangerous had that hematoma formed inside her skull. Because remember, inside the skull, there's no place for it to go. So pressure builds up, and then that pressure is dangerous for the neurologic tissues, the brain itself. If there's no fracture and it's just superficial bleeding, it looks worse than it is in many instances. Oh, this is the same person? Wow. Pretty incredible.
More busy with the left. Oh, good right hand by Barboza.
Oh. Stop the fight!
Look at, he hits him.
Oh my goodness.
Wow. Most commonly, when you see a strike, it right away incapacitates a fighter. But in this situation, there was a delayed response, which could be that the muscles were still, they're firing, and then only after the brain recognized what's going on, it completely shut down and went into a prone position.
Siéntelo con ese tercer asalto como tú lo comentabas.
That looked like it was to the frontal bone, the top portion of the skull there.
Mira, directo a la nariz.
Oh, right on the
Jueces,
nose.
primero vamos a darle un aplauso para una tremenda.
Oh my God, look at the nose. It's like completely sideways. No, don't fix it. Just wait for the doctor. I mean, the nasal bones are so tricky. There's a lot of cartilage there, and one of the most worrisome things is that you can get a nasal septal hematoma there, and that type of bleeding into that section is dangerous and problematic and requires urgent attention. The blow was so bad that Perry started having trouble breathing and ended up being hospitalized. Perry underwent successful nose surgery in Uruguay.
Mike, it's good to see you and your new nose. It's looking great.
Look, can you do this, Eric?
My dear.
Can you do that?
Here we go. Ooh, heavy low kick.
He kicked me right here. There's a nerve, a perennial nerve that will shut your foot off. His toe, his big ass Ecuadorian toe, hit my perennial nerve right here. It shut my foot off. My foot was completely numb. Went to step back on my foot, but my foot didn't work. I fell down.
So you roll your ankle. The peroneal nerve, or the common fibular nerve, is a branch off the sciatic nerve. Most people have heard of sciatica. If you get hit there, it actually can paralyze the nerve. Paralyzing that nerve, at least temporarily, what can happen is you develop foot drop, where you don't have the muscle called the tibialis anterior on the foot to actually raise up your foot, so the foot drops. And then there's also some weakness in the muscle on the outside of the foot, so your foot basically falls inward. And obviously you can't step on a foot that's flailing. You lose your base, all other issues occur.
Oh! Huge elbow from Shield! Big shot! The leg. And again, look, he's limping back.
Consider taking this fight to and Jose Aldo just to go here. Discipline.
Oh.
And again, scramble. Very freely kicks it right up on him.
Without a good base, it's near impossible to have a good fight. Oh my God.
Up left hook to the midsection, down goes Fabe.
Yeah, he had to get carried back to his corner. I mean, they didn't want him using that leg any more than he has to.
Wow.
Day after the big fight, dude.
Leg kicks are deceiving, man. It feels like I was getting hit with a bat. That's the first time I've really been punished with those. You can kind of see here. My leg matches
so
my
much
shorts
swelling.
here.
Oh my God, look at that. Oh, Jesus, look at that.
That's a serious hematoma there. Remember, when you hit muscle bleeds. That's what bruises come from. And if you hit the muscle enough, you could actually have electrolyte disturbances and neurologic disturbances where the muscle starts firing, not firing, shutting down, being slow to react, cramping. So that's what's happening every time you're getting kicked.
They kind of have to wait for like the swelling to go down and stuff before they MRI or anything, right?
Well, first we get x-rays to make sure bones aren't broken. And what's interesting about x-rays is they're not incredibly sensitive. They don't catch all stress fractures, for example, or really small fractures. So in that instance, we do get MRIs. You would prefer swelling to go down. Now, on the other hand, if you wait 2 weeks and the swelling goes down and the patient's fine, clinically, there's no issue, getting an MRI might be overkill.
They'll
therefore very fluid and relaxed here in the early going.
Oh.
There it is again, that left high kick.
Oh.
And Bisping is opened up and in all sorts of trouble. That'll do it.
When was your vision first compromised? Was it after it was after the Vitor fight, right?
It was the Vitor fight that did it, and I slowly started getting symptoms. I was doing this a lot in restaurants. You know, restaurants are dark, some of them. I was doing this, you know.
He wants to see if he has peripheral vision.
My friends would be like, oh, he's doing that thing again with his hands. I'm like, can you see your hand there if you do that? By the end, it was like right in front of me there, and I couldn't see. Called the doctor, and he said, yeah, you got a detached retina.
Interesting, because the detached retina happens quite suddenly, and there's 3 different signs that we look for, or symptoms that we look for in patients. One is like the quick loss of vision. Some people describe it as a curtain going over the eye. New floaters in the eye, like happening very quickly, and then also flashing lights. This is a surgical emergency that we are taught to refer and get them treatment within 24 hours.
It's just a bump in the road, hopefully.
The surgery lasted over an hour. They injected oil in my eye, they used a laser, they put a silicone sponge around the outside, and eventually reattached my retina.
It redetached, I got glaucoma. It was just bad luck, one thing after the other. Anything that could go wrong with an eye went.
The thing was with the eye, when you start performing surgeries on the eye and then still continuing combat sports, it creates all sorts of different risk factors. That's why when I was talking to some of my ophthalmology colleagues about getting LASIK before my boxing match, they were telling me the different options, some of which carried a higher risk given the fact that I was going to experience head trauma as a fighter.
How did you pass this test?
With great difficulty. Lying, cheating, bullshit codes. I lied to so many doctors.
It's pretty sad to hear that he had to do that because it put his life in jeopardy.
And I'll show you right now. So as we see, there is the prosthetic lens. So I definitely can't live without this thing.
That's really cool. I have no idea about prosthetic lenses. That's above my pay grade.
There's no point of comparison for Ferguson. I don't know who you'd compare.
Oh, that elbow. I felt the elbow.
Hit him with that right
The
hand.
electronaut.
Like Cerrone maybe blew his nose, and that right eye now is almost completely closed.
Oh, no.
You can't blow your nose. Doctor said you can't fight.
I think I watched this fight.
You can't fight. Doctors tell him he can't fight. The doctor's protecting him.
Yeah, I mean, his eye is absolutely terrible. There's probably a fracture in there somewhere that's causing air pockets to go into his eye, making it completely swollen shut. And that's dangerous, not just for the eye itself, but also for the fighter, because they're not going to be able to see a punch come from that direction.
You blew your nose, which is something you're never supposed to do, and your eye swole up.
I also used to see, I think this was in a Rocky movie, where they would cut the eye that is really swollen and allow it to bleed.
I can't see nothing, gotta open my eye. Come here, Mick.
We don't do this. This is highly illegal and dangerous for so many reasons. A lot of vital structures there that if you damage, that could be permanent.
Kamaru, I gotta go to you, man. What does Jorgen De Castro need to do right now, man, to get back in this fight?
His shoulders out.
Wow. Talk about sportsmanship.
But the ref has to see it.
Oh my God, he's trying to put it in himself. That's bone on bone grinding there. Remember, bones have articular cartilage, so it's cartilage that rubs over the head of the bone that allows it to move smoothly within that joint. Then there's the labrum that keeps it in place. And if you have issues with your labrum or ligamentous laxity or weak tendons in that area, you can be more prone to developing a dislocation.
If they put it back in the socket, could you restart?
Of course. Medically, yeah. If they were able to reduce his shoulder really quickly, again, I don't know the rules here, but he might be completely fine. There's instances where someone has a very loose shoulder, so much so to the point where it comes out frequently, they're able to pop it back in themselves and continue fighting or doing whatever it is, so. Oh, that's when his leg gave out. Oh. It's not a dislocation. That's a displaced fracture. Oh, stop showing it.
You can't watch it. None of us stand a chance.
No, I can't watch it. I mean, I'm still a human.
I was injured going into the fight. Let's People are asking me, when was the leg broke? At what point did the leg break? Ask Dana White, ask the UFC, ask Dr. Davidson, the head doctor of the UFC. They knew I had a stress fractures in my leg going into that cage.
Stress fractures certainly put you at risk for a complete fracture. This is why I frequently have patients who are drastically increasing their mileage training for a marathon or something. And I see a stress fracture, they have pain in their bone. I diagnose them and I tell them, don't run the marathon because you could snap your leg. And they say, no, I'm good. And then things like this happen. And that's the risk. That's the risk of continuing to train under stress fracture. There's actually some unique tools that exist through sound. They can speed up healing. It's pretty interesting. I've seen some preliminary research on them being beneficial. I haven't checked in on the research over the last few years, but they look like this and they're pretty cool in that they could potentially speed up healing of fractures, which is great for professional athletes.
So now I've got a titanium rod going down the knee, from the knee to my ankle. And the doctor said it's...
Hello, 911. I am dying. 911, let me see. What meme are you looking at? Guy, no, I'm literally dying. Having my ass off, tag me. And he's playing solitaire. 911 shouldn't be talking about memes. You have to be supportive, but to be supportive could mean that you're sending someone a meme. This is a deep one. Do babies grow on their own or do we need to interact with them? I forgot to look at the group name and I was genuinely concerned. They thought you had to plant them in the soil and allow them to flourish through photosynthesis. I turn up music because I'm partially deaf. I'm partially deaf because I turn up the music. Yes, 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 if there was a more accurate meme, I don't know. The reason this meme is so accurate is because so many of us listen to music on full blast, especially with in-ear headphones, audio canceling, noise canceling headphones, so we just hear the music. And if you listen to anything over like 60-ish%, you're damaging your eardrums. Look at how quickly you can develop eardrum damage, tympanic membrane damage, based on the decibels and how long you need to be exposed to said sound. Peebus, food grade, just fizz. What's Peebus? Is this an actual drink or is it just fizzy? Kurgerbing? I'm confused. Is this what people with dyslexia see when they see a Pepsi? Am I missing something, Sam? Worst pinata ever. I just had 3 of these removed because they were coming for me. For those who don't know, this is some kind of bee wasp nest. Beehive, wasp hive. Is it a wasp hive or do wasp hives live in beehives? Do you think a wasp can go and mix it up with a queen bee?
I think they're very customized.
I think queen bee's only interested in one creature.
Herself?
Jay-Z.
Oh.
Let it sink in. Let it sink in. Queen bee.
Beyonce.
Yes! Worst pinata ever. Followed by the worst joke ever. What the predator sees after 15 seconds of chasing. For those who don't know, the predator can see inside of you, thermal imaging so it can catch you in the forest. But now it can catch your psoriatic arthritis or rheumatoid arthritis. And I say that it's autoimmune arthritis because it's polyarticular, which means that it's in multiple joints. Polyarticular. Stop dieting, start farting. And that's the way you get ripped. Just a little gassy monster, just like Bear. Y'all ever just say F it and eat it with the shell? No, with sunflower seeds maybe, but not with the Big Mac paper. Don't eat paper. I had no idea you could buy this. I've just been using chocolate and Netflix. I've been just using puppy slobber and dog kisses. And never hurts to have a good protein chip. Yeah. My head hurts, my throat's scorched, and I have terrible taste in my mouth. Man, we got lit last night. Also, you got carved. And if you get carved and lit in the same night, medically, not compatible with life. This is how you make neon green. The neon green. The neon green. It's the first pun that I got right away. Verde. Verde. Sam Bowers, if you're in this Discord, your life needs to be consuming Dr. Mike videos 24/7. Turn it on your phone, TVs, tablets, watches, you name it. Whoa, we got Mama Dr. Jones on the telly, Brandon Marshall on the laptopy, gaming on the other laptopy, a little kitty watching Brandon Marshall. Oh, and Mama Dr. Jones on the lower laptop, and on the iPad, we got a medical memes. You know what? I approve of this image. Sam, did you really write that?
I did.
That's really sweet, actually. You're fired! when I start seeing Christmas decorations in early November. Seriously. Don't put Tabasco in your eye because it's really gonna burn. The capsaicin doesn't mesh well with the eyes. That's why if you're eating like spicy food and you rub your eyes, oh boy, that's a disaster. Lots of watering, lots of histamine response. Ooh, pain. If overthinking was a workout, oh my God, I would have an 8-pack. I would have a 4-head and an 8-pack. No, I would have even like oblique muscles because you know sometimes when I get angry, you've seen that vein come out. Some people have that vein on their abdomen too. Hope everyone is enjoying the long weekend. Yes! Yes. I see you've been stabbed. Yes, please help. Are you sure that's what's causing the problem? Because I was looking at your BMI. Is this like a judgment joke? Oh, Bear came in. Come say hi to the meme community. Come on up. Oh, his breath is bad today. You can't have my Quest protein chips. Sorry, Bear. Not for you. Not for you. I don't understand this meme, Bear. It should have been like, please help. And it's like, oh my God, you really do need help. Yes, I've been stabbed. Oh no, I was talking about your BMI. Yeah. I just meme fact checked you. Elizabeth Stanton / Elizabeth movies. Nah, man, night shift is pretty easy. Derek, age 24. Oh my God. You could see the wear and tear that waking up at 7 p.m. has caused on Derek. Not only are there conditions related to working a night shift, like night shift work disorder, but there's also evidence that those who work night shifts have more health problems in general. If you had a choice and you don't love working night shifts, I think the healthier choice is to work during the day. But you know, there are some services that require someone to be at night. And there are certain people who, based on their chronotype, prefer to be up at night. Matthew Walker and I actually talked about this in a whole video. Doritos. Ew! As I saw that image, I thought about licking my finger, and then I was like, oh, you don't want to do that with the toe. It's sweatier and there's fungi sometimes. Ugh. Brother, Humans, I can barely sleep at night. Also humans before sleep. Not just light, massive anxiety, stimulant substances, explosions and loud noises, naps close to bedtime, huge meals. These are all things that can hurt a good night's sleep. Just before you die, swallow a whole bag of popcorn kernels. Your cremation will be epic. Oh, I wonder if that's true. Probably not. Because I feel like cremation happens at like over 1,000-degree temperatures, and I don't think the popcorn pops then. I think it just like shrivels. 100% fish-free wild-caught microplastic. Not great. Honestly, that's these days is a sad reality that there's a lot of microplastics in the foods we're consuming. The solution for which I do not currently have. She donated 30 inches of her hair to make wigs for children with cancer. Oh, that's nice. Now, some poor kid has to be a ginger on top of having cancer. That's messed up. Oh, I did not feel that coming. Sam, did that one burn you?
It burned me because of my beard?
Yeah.
Yeah, I can hang top of it.
It's a unfair thing for people to write mean things about people's hair color. Making my famous BBQ dry rub. Why are you I would advise against doing this. That's rubber. That is not digestible material. That can cause an intestinal blockage. You know what can happen? God, I forgot the name of the exact term. It's when you get like this constellation of hair, maybe other substances that are indigestible, and they cause like this bolus. A bezoar. Hair mixed with rubber and some other contents is called a bezoar. 4 sneezes in a row is clout chasing. Get it together. It really is. It's not clout chasing. It's like attention-seeking behavior. My brain when I read the word hippocampus. Facts. It's in the brain. That's all you need to know. You're good. Otherwise, you're good. There's a definition if you'd like to read it, but just know that has nothing to do with college and has nothing to do with a hippopotamus. Having a deconstructed Diet Coke. Diet Coke caffeine-free with caffeine pills. That's a lot. That's like the other day I heard someone say like a Napa latte, which is like you take a nap and you have an espresso so that when you wake up from the nap, because it takes like 30 minutes for the caffeine to kick in, you get like double the rest because your body clears the adenosine, which makes you feel more alert. And then your body also blocks the adenosine receptors with the caffeine as well. Kind of interesting. We'll see the baby in a minute. Your plan doesn't cover the ad-free version. Ah, it's so sad that the EKG strip is so inaccurate. And why is there dynamite behind the EKG? Well, that's a little weird. I'm never lonely because I got these little guys with me. You know, it happens to me too, and I don't even have a good answer. Floaters? I don't know. The little squids that hang out with you. Medically, I'm not saying it right, but it's funny. If a movie character gets shot here, they're required to keep it to themselves for a while. Later in the movie, they must open their shirt jacket, revealing an alarming amount of blood, followed by another character saying, "You're hurt." This is law. How do you not notice getting shot in the abdomen? It's like one of the most painful places to have a trauma. Although, you know, the retroperitoneum, like that specific area of your abdominal cavity, can actually hold a lot of blood without you realizing that the person's bleeding. Very interesting. Vitamin B12, intestine, intrinsic factor. Oh, word! You need intrinsic factor to be produced in order for your body to be able to get the B12. And sometimes believe it's called pernicious anemia, where you lack intrinsic factor and therefore develop anemia due to a lack of B12. Should I fact check myself? Pernicious anemia is a type of B12 deficiency anemia that occurs when the body doesn't produce enough intrinsic factor, a protein that helps the body absorb. Not even a hematologist off the bat knew that. It's weird that after 10 years of practicing medicine, I'm excited the fact that I knew a fairly common condition. Fairly common in the sense of like it's tested often. I should have known that and I shouldn't be as excited as I am, but maybe it's because I have enough protein. I got my vasectomy done at Claire's. They started with ears and then they went to the vas deferens. Let's just say the work they do at Claire's is vastly different than what they used to do with ears. Now it's not about holes. It's about ectomies. Damn it, I couldn't find that landing.
Really close. Really close.
Sleigh bells ring. Are you listening? Chest is tight. Nitroglycerin. Nitroglycerin is a vasodilator. Helps open up blood vessels so that you could perfuse certain parts of your body that are very important, like the heart. And we need to give this medication. And it's one of the more important times you need to be honest with your doctor and tell them if you're taking sildenafil, also known as Viagra, also known as... That's clearly a case of cosmomatosis, where the cosmos actually penetrates your skin.
I think that was legally your fault. Get the first aid kit. Do me a favor and don't be dead.
Does he need CPR? Because I totally know CPR.
Thank you for offering to do chest compressions, but a person who's awake and alert does not need CPR because their heart is beating. Otherwise, they will not be functioning.
You, what realm is this? Alfheim? Dornheim?
New Mexico?
You dare threaten me, Thor, with so puny a weapon?
Oh, that's a taser. Everything in your body is essentially an electric process. And when you get zapped with 50,000 volts, you essentially lose control of all of those processes, therefore you collapse.
Hi. Just taking a little blood.
How dare you attack the son of Odin?
Need some help. I'm trying to help you.
Oh, I don't want to get hit by Thor. See, if I was in there, I would be boxing him. Yo, I got you, son.
You're no match for the mighty.
That looks like they gave him a short-acting benzodiazepine, probably. Sometimes we used to do promethazine and haloperidol, but the benzos seem to work a little faster and better.
Ladies and gentlemen, today we take not another step towards annihilation, but the first step on the path to peace. We begin with a series of micro-injections into the subject's major muscle groups. The serum infusion will cause immediate cellular change.
I mean, the reason we do all our injections, well, not all our injections, so we do some underneath the skin layer, but we also do intramuscular injections for things that need to be rapidly absorbed.
To stimulate growth, the subject will be saturated with Vitarex.
I hope it's clear that this is fantasy. There's no thing that you can inject into muscles and just make them explode. The only thing that is somewhat similar to this is synthol, which is an oil that I've talked about in the past that some TikTokers use to make their muscles appear really big, but they're not functionally big, meaning they're not stronger by any means. And that's a huge amount of serum to inject into each of his little muscles. Like he's gonna be edematous, if anything. If you only knew how many times I looked up this image of his body and his workout so I can get his pecs, because I was obsessed with this look. Like, this is my dream body right here. God damn you, Chris. Even the haircut's fire. Whoa. That's a bomb, baby! Damage to his tympanic membrane is definitely happening. Explosion's so close to you, like, ow. Oh, and he's bleeding. That's not a good area to bleed from, because that's where the heart is. Who's performing surgery with a patient awake? That's just torture. Did they chloroform him? That's so evil. And the only reason I say it's evil is because, like, chloroforming someone by allowing them to inhale it by putting a napkin over it that's doused in it, it's not uniform. You don't know how much dose you're giving. You don't know how long they're gonna be knocked out for. It's my worst fear, waking up in the middle of a surgery. I think that's everyone's worst fear. We just don't think about it often. That's an NG tube. Not sure why he has an NG tube. An NG tube is a nasogastric tube that runs from your nose into your stomach to either pull fluids out, or it's to feed him because he can't eat on his own. It does come out like that, so that is accurate, just kind of gross watching it. And this is where the medical accuracy ends. Fantasy begins.
What I did is to save your life. I removed all the shrapnel I could. There's a lot left, and it's headed into your atrial septum.
The atrial septum is essentially the separation between the two top components of the heart. Now, if there's shrapnel there, if it's not causing a problem, I guess you could leave it, but I don't understand how it can enter into the septum and not cause severe bleeding in the heart between the atria, or at least out of the atria into the pericardial space.
What is this? That is an electromagnet hooked up to a car battery. And it's keeping the shrapnel from entering your heart.
Basically what he's saying is he's trying to keep the piece of metal shrapnel inside the actual meat of the organ as opposed to the circulation part of the organ, so it doesn't get shot out into the general circulation and end up doing more damage. Like, if it starts going into the brain, that's lethal.
God, is that the thing that's keeping you alive?
It was. It is now an antique. This is what will be keeping me alive for the foreseeable future. I'm swapping it out for an upgraded unit.
I don't know what that monitor is showing behind it.
Is it safe?
Yeah, it should be fine. It's like operation. You just don't let it touch the socket wall or it goes beep.
What do you mean operation?
It's just a game, never mind.
Great game.
Okay? Great.
Maybe take your ring off first.
You know, I don't think that I'm qualified to do that.
Yet you feel qualified to give very inaccurate advice on goop.com. Very interesting.
What is it?
GSW.
GSW means gunshot wound. I don't know why we say GSW when it's actually more syllables than gunshot wound.
It's impinging on the medulla. I needed a specialist. Nick diagnosed brain death. Something about that doesn't feel right to me.
We have to run.
A bullet in the brainstem is dangerous for so many reasons, mostly because the brainstem controls your respiratory rate, your heart rate, all these autonomic functions. If they're not active, you can't just think heartbeat, heartbeat, breathe in, heartbeat, heartbeat, breathe in, stomach work. If they didn't happen automatically, you die.
We need to get it prepped for suboccipital craniality.
Not gonna let you operate on a dead man.
What do you see?
A bullet?
A perfect bullet. It's been hardened. You harden a bullet by alloying lead with antimony, toxic metal. And that's leached directly into the cerebral spinal fluid.
Rapid onset central nervous system shutdown.
We gotta go.
He's basically saying some kind of metal from the bullet is impacting his central nervous system. Therefore, he's not really dead. He's acting like he's brain dead, and he's gonna save his life by removing the bullet by doing a radical procedure. Only in a Marvel movie.
Cranial nerves intact.
Those look like alligator forceps. I love using those to get earwax out of patients' ears, especially when it's like hard and you could go in there and just like grab it. So satisfying. Okay, this is really funny. This is really funny. And I'm not a surgeon, I've never worn this device. But looking at this image, the things he's wearing on his glasses to get a better view, are they not covering his field of vision? And then the actual lenses are lower than his eyes? Oh my God. He can't see through those.
Can you send me the... Got it.
Who wants a surgeon that is getting pictures of patient records on their Lamborghini and then crashing their car? Looks like he has a lot of fractures in his hands, requiring some kind of orthopedic device with pins and needles. I've never seen it on the outside like this. This is very exaggerated. But remember, the bones in the hand are quite small. The carpals are very small. So putting in pins is not always a simple process, especially the big size pins that they have there. It's gonna take a lot of physical therapy, so shout out to physical therapists, but also occupational therapists as well. Because when it comes to rehabbing the hands, you gotta think about fine motor control, especially for him as a surgeon.
Show me your strength.
This is him getting that therapy I was just talking about.
This is useless.
If the patient is struggling this much, we have to decrease the intensity of whatever therapy we're doing. It's about allowing them to do it successfully several times and then increasing that intensity as time goes on.
Have you ever known anyone with nerve damage this severe to do this and actually recover?
One guy, yeah. Factory accident, broke his back, paralyzed. His leg wasted away. He came in 3 times a week. A few years later, he walked past me on the street.
Walked?
Yeah, walked.
Show me his file.
It took me a while to pull the files from the archive.
You can't just show people patient records. Come on, guy, HIPAA.
But if it proves your arrogant ass wrong.
He is an arrogant ass. And as a surgeon, like Dr. Strange, you should know that people recover from severe strokes, traumas, tumors, and regain neurological function. The progress that patients make under the care of PM&R, physical medicine and rehabilitation physicians, is truly magical. It goes to show that the human body has an amazing capacity to heal itself. That's the principle of osteopathic medicine that we live by. And it's not because I love that principle, it's because it's true.
Christine!
Steven? Oh my God.
You get me to an operating theater now. Just you. Now, I haven't any time.
You can't just run into a hospital and request an operating theater.
What happened?
Stabbed. Cardiac tamponade.
How does he know he has cardiac tamponade? If you've been stabbed, you can actually die from cardiac tamponade. But how he knows that without doing an echo, listening for heart sounds, and all this other stuff, I have no idea.
Chest cavity's clear.
I don't know what she just did to know that the chest cavity is clear. She went... Okay, this is the non-medically accurate part of the show. If someone has a pneumothorax where their lung collapses and you're sure of it, you could put a needle into the second intercostal space, which will allow you to allow that air to come out, normalizing the pressure, allowing the lung to re-expand. Whoa, we don't do it like that, bro. Can you imagine if we just are like, okay, I'm putting it in, and you have to make sure you're palpating the area as you do it. You're not just like stabbing randomly from far away. Like by holding it from so far away, you have very little control of where you're actually putting the needle. Okay, he's flatlining. If she takes out the paddles, I will scream. She's taking out the paddles! Stop charging them! You don't shock asystole! Chest compressions, chest compressions, chest compressions. Clearly they need this. This is the Chest Compressions University merch. 2 inches deep, 100 per minute. Please do chest compressions when someone's heart stops.
Chin. What you do have is bad posture. So all you need to do is 2 steps. Bring your shoulders up, back, and down. Bring your chin slightly forward and then slightly down, and look at the difference that
That's backwards. No, you want to keep your shoulders open, chest open, facing the world, ready to take on challenges. I don't know if you notice, I've started working out again. I'm really sore and this really hurts.
Things TikTok made me buy. Ooh. This is a phone charger that supposedly leads you to the strongest power source in the entire house. Oh no.
Oh, it went to a mitochondria. Powerhouse of the cell. Touche. Golf clap for that. This gives new meaning to walking your dog. Honestly, if my dog walked like that, I wouldn't put it on a leash. I would just say like, look, my dog walks next to me. I would hold its paw. When you finally get that long white coat and your boys invite you over to watch the game, students wear short lab coats, white coats, and doctors wear long ones. So if you ever see people in short white coats walking around, they could be students.
I can't take it off. I can't take it off. Like, take it off. I can't. Take it off. I can't take it off. Like, take it off. I can't.
You don't want to take it off. I remember when I was a student and I went through my white coat ceremony and I had my white coat for the first time. I remember pulling up to Coney Island Hospital, parking my car 2 blocks away, and proudly wearing the white coat as I walked the 2 blocks from my car. When really I still had like 7 years of education left, and I'm like, this is gonna be stressful.
Do you remember that patient you saw yesterday for chest pain?
Malpractice lawyers near me. Fire doctor, anything helps.
Yes, how come? I ran into her today. She's doing so much better. Thanks for your care.
It's so true. I will literally have someone from my office staff say, oh, you know that patient you saw for something? And the anxiety level starts creeping up. Like, did something bad happen? Did they file a complaint? And it's not because that happens often. In fact, that's really rare for it to happen. But there's this fear that you did something wrong because you want to do right by everybody. It is scary. You want the best for your patients. And as a doctor, you're gonna miss stuff. You're gonna misdiagnose things because patients' conditions don't always present so clearly. They take time to develop. Part of the art of medicine.
Ugh, I have such a bad headache.
I have essential oils.
Wait, is this safe?
Of course, doctors use it all
essential
the time. It
oil
literally cures anything. Here, breathe this for 30 seconds. Keep breathing it in.
Burning my eyes.
That means it's working. Closer. You have to believe in it or it won't.
He's like chloroforming her with the essential oil.
Or it won't work.
My eyes are literally burning.
Almost forgot the crystal. Just keep breathing.
I don't want to do this anymore.
He threw in a Reiki crystal.
Just one more oil. Feel better?
My headache's gone.
I told you.
Wait, is that grapefruit?
Yeah, why?
I'm allergic.
So I don't have an essential oil for that?
He's gonna need an EpiPen, and luckily he's not over the Atlantic Ocean. If you haven't seen that story of mine, link down below.
Saline implants are made to withstand almost anything. Watch me as I try to break it.
Oh, what? Okay, I don't know if this person is a legitimate doctor. I don't know what the purpose of fighting that saline implant was. I don't know the durability of saline implants, but I'd like to think they're quite durable. I don't know if they're made to be twisted and turned like that. And I've actually had patients come in who had an implant that ruptured, saline implant. The one experience I've had was a patient came in and she walked into this, like the edge of her car door, and like she like kind of turned in and didn't expect the door to be there and it punctured the implant. Ooh, that hurt. But we right away got her an urgent plastic surgery eval and it got figured out.
Sweetheart, there's no need to worry. You won't feel a thing.
Why when anyone on TikTok tries to play a female character, they put a disgusting white towel on their head and they're like, oh, that somehow represents female hair.
Okay.
If you ever enter a pediatrician's office or a family medicine doctor's office, there is screams galore. That is part of the process. Because children are naturally nervous. They get scared. There's stranger anxiety. This is part of normal development. And when we give vaccines, even if it doesn't hurt that much, it's scary. Imagine a stranger bringing a needle to you. So yes, there are screams all the time. My strategy is to give the child a distraction and sometimes a present before I do anything. Not, I'll give you a lollipop if you listen, but here's a lollipop, so you listen.
I just want you to know that I miss you and I love you. Can't wait for this show to be over so that I can touch people.
Touch people? No, honestly, like I want to go back this sounds weird, but to touching people. I want to go back to shaking hands. Insider, I don't know if you follow it, it's an Instagram account. They recently posted that like handshakes are about to become a thing of the past. No, it's not, Insider. Handshakes are an important part of nonverbal communication for humans. It's how we trust others. It's how we show we have no weapons from back in the day. But it's like a way to communicate with someone. A handshake tells a lot about that person, about your relationship, about how you're gonna communicate. And the fact that there's a pandemic going on, sure, we can suspend it now, but it doesn't mean we need to be afraid of all germs and become germ phobic. Pandemic, no handshakes. No pandemic, handshakes. See how that works? We don't have to swing the pendulum the complete other way every time something happens. That's funny. Oh my God. So yeah, there's Hodgkin's and non-Hodgkin's lymphoma. And again, they're using the little towel or the pillowcases for the hair. I don't get it.
Come with me and you'll be in a world of HIPAA violations.
HIPAA violations. For those of you who don't know, HIPAA is Health Information Patient Protection Act. Health Information Patient Protection Accountability Act. Health Information Protection Accountability Act. It's down below. No. When I was in the hospital and I worked the 36-hour shift, I wasn't like... In fact, when you're leaving the hospital after a 24-hour, 36-hour shift, you're literally walking with your eyes half closed, body fluids all over your scrubs, placenta on your shoe if you're working in the OB department. Residency is a hard time. There would be a period where I wouldn't see my friends for a month. And they're like, where were you? I'm like, ICU life. 6 days a week, 18-hour days, tough.
Good morning, sexy doctors, and welcome to hospital. 6 of you will die this season, and I don't want to catch any of you having sex in the on-call room, unless it's with me. He's coding. Nurse, get 5 cc's of parallelograms and 1 segogenesis.
The chest compressions are like this, and she's getting parallelograms and segogenesis, which is the first ever video game console I've owned. God, that's brilliant. Medical dramas are so inaccurate. Uh-oh. Are they cutting into it with a Cuisinart knife? That is not an approved medical piece of technology. That's made for chicken and steaks. That was a good flap. I'm not gonna lie, solid flap. Was that supposed to be a delivery of macaronis? Those are little macaronis. How did they get the macaronis inside the banana? You guys are gonna probably laugh at me. Those aren't macaronis, right? Those are like fettuccinis or, God, what's like the long pasta called? It starts with a Z. No, it doesn't. Let's give another huge thank you to ExpressVPN for sponsoring this video. The link is down below. That's one confident doctor. Can you imagine if I walk into a patient's room back, Dr. Mike really knows his stuff? I want to do the blood pressure cuff like that on my patients and they just float up. Be good times all around.
Hi, Mom. Emmy, I just saw your mom outside. Time for you to go home for dinner. Okay, thanks.
Why do I feel like Doc McStuffin's mom is an actual doctor? She had kind of the doctor bag, the doctor white coat.
How was work, Mom? Did you have any cool patients?
Oh.
Nothing too interesting, just a few colds. Oh, and a sprained finger.
It sounds like she's a family medicine doc because she's seeing people with colds, minor musculoskeletal complaints, which means that there's something wrong either with the muscles, nerves, or skeletal system, like the bones. I'm the type of doctor that Mama McStuffins is also. She could be also an ER doctor.
I have a really interesting patient. Ooh, if you need a second opinion, you know where to find me.
Aw.
Okay.
So a second opinion is exactly what it sounds like. When one doctor says, here's what I think is going on, they can go see another doctor and the other doctor can lend their opinion and say, well, here's what I think. And they can either agree or disagree, and then the patient can choose whose plan to follow.
The doc patient.
Ooh.
Come on out, Jack!
Ha! Big Jack's the name, Poppin's my game, and here's... Little Jack! You okay, little Jay? You're not quite popping like yourself today. He's gonna be okay, right, Doc? You can fix him, can't you?
Don't worry, Big Jack. Little Jack's in good hands.
That dinosaur just gave the perfect answer. When someone's going to see the doctor, you don't want to promise that everything is going to be okay because you may not know. Little Jack is in good hands. That's the ideal way to speak as a doctor. That we're going to try our best. We're going to figure out what's going on. We're going to come up with a plan. You never want to promise anything. In medicine, there's a lot of times the outcomes are outside of our control.
Hi, Little Jack.
Aw.
Hi, Doc. I want to help you so you can pop up like you used to. Why don't I give you a checkup?
There's actually a secret that I'm going to share with everybody right now that comes from some of the leading psychologists across the world that I use in my office to get kids to trust me with their care. How often do you hear a doctor say something like, if you get this shot, you're gonna get a lollipop or a sticker? That's good. But the better way to do it is to give the lollipop first, to give the sticker first. Create a rapport, get on good terms, be happy together. Then they're more likely to trust you to get the shot, to allow you to look inside their ears and mouth. That's the secret.
Hey, Little Jack. You want to pick out a sticker that you can put on your box when you're done?
No way! Did Doc McStuffins just steal my secret that I shared with you guys? She's giving him a sticker before it starts. This is the theory of reciprocation. She's a genius.
Why don't I give Big Jack a checkup first so you can see what I'm gonna do?
Ready when you are, Doc.
See, this is a great strategy. I'm super proud of Doc McStuffins here. What she's employing is like a phobia desensitization strategy. Basically, she's allowing little Jack to see what happens because the biggest phobias happen when you fear the unknown. All right, I'm calling out the medical inaccuracy in Doc McStuffins. She's taking a blood pressure using a sphygmomanometer. However, in order to properly do this, you need to not only see the pressure, so you need some sort of gauge, but you also need to put on the stethoscope and put it on the person's artery to hear the sounds.
Looks good.
What? How does she know it looks good? Use your stethoscope, Doc McStuffins.
Now use this light to look in his eyes and ears.
Whoa! Red flag. We don't use the same instrument to look in the eyes and ears. The ophthalmoscope, which is the device that we use to look into the eyes, is flat, so you can't hurt the person. You gotta be careful.
Okay, Big Jack. Open wide. Well, Big Jack, that's it. You look healthy to me.
What about his heart and lungs, Doc McStuffins? I need a complete physical exam. You need to look at the whole patient.
I see the problem. What is it? Your clothes are stuck in your music box. That's why you can't...
That's the classic condition known as shirto-gear stocking syndrome.
This looks to me like a clear case of can't pop-itis.
Oh, come on, hers is so much better than mine. So if you have anything with an itis at the end, that just means inflammation. So I don't know why it's called can't pop-itis, but A for effort.
Almost got it. There. I did it! I can pop up again!
When kids get sick, they get really down. They have high energy levels and they get really sick and parents get scared, rightfully so. When children start feeling better, they pop, ironically, pop back to life really quickly.
You fixed it! Do it again!
Smooth with a little wink.
Only one more lap before Ricardo wins the race! Come on, you can do it! Whoa, wait, what's wrong?
Don't tell me Doc McStuffins is a mechanic too.
I'm sure there's just something wrong with him. Why don't I see if I can fix it?
Good idea, Doc. And while you're doing that, I think today might be one of those days that Donnie needs a little nap.
That's a dad who knows what he's talking about. When you don't sleep enough, you get cranky.
Put me down and I'll show you that I still have plenty of zip.
Great, and I can observe what's happening to you.
You and I can't go on.
It sounds like the symptom is called dyspnea on exertion. It's basically when you get really tired and short of breath and you can't catch your breath when you're trying to be active, like run around or walk around.
You'll be back to winning races in no time.
You mean I can be in the best race car ever race?
I hope so.
See, again, she's not over-promising. She's saying, I hope so.
What are you gonna do, Doc?
Oh, look at Doc McStuffins washing her hands before seeing the patient. Doctors should always do that before and after seeing the patient. This type of hand hygiene decreases the likelihood that the doctor will be spreading infections to patient and also to herself.
Open wide.
Oh, that's a good.
Looks normal.
That's a good
Can
one.
you say ah for me? Okay. Now can you give me a big vroom vroom?
So the vroom vroom is like take a deep breath for me. I see the analogies.
Ricardo, you raced like a bajillion times last night, right?
Yes, a bajillion. Exactly.
And when was the last time you recharged?
Oh, you mean my batteries? Oh, I don't remember. Several days ago.
Just like I thought. You must be out of energy.
Tell me Doc McStuffins is talking about burnout. She's tackling one of the biggest issues of our time. Sometimes our batteries run out of energy and we need a recharge.
I have a diagnosis.
Oh, I want to hear it. I'm going to call it low battery itis.
No rheumatosis.
Oh, no rheumatosis. That's not bad.
Could you plug Ricardo in for me? I think he wasn't working because he was run down, so he needs to recharge.
Sure thing, sweetie. Ah, vroom, 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 vroom. I am so fast. Eat my dust.
Oh, he's dreaming. See, when we recharge, it could mean that we take a nap. It could mean we go on vacation. It could just mean we take our cell phones and put them away and take a break from looking at all of these social media sites and everything else. I can't believe I'm getting all this philosophical stuff from watching Doc McStuffins.
Oh, wow! Oh, I feel great! Do you see?
Full leg cast above the knee. I don't know what injury she had.
Say, that's not a bad idea. Ow!
What happened?
Munchausen syndrome in full effect when a patient pretends to be ill in order to gain attention and or sympathy. There's actually a Munchausen by proxy where someone can actively make like their child ill to get attention and sympathy for the both of them. It's a really devastating illness because it presents so many complications. Like the doctor has to even suspect that it's potentially happening.
What are you gonna do?
I'm gonna take pictures of your insides. Say cheese!
We don't get full body x-rays for a leg pain. Like, there's no point of that. It's just exposing you to more radiation. They're targeted.
It's kind of strange at first, but after a while, you get to like it.
When the x-ray tech or the radiology specialist is in there with you, they actually start the machine up, go behind a wall so they're protected because otherwise they're exposed to so much radiation over the dozens and dozens of tests they do in a given day. It's not healthy.
We'll be sick forever unless I can extract some mitochondria from the virus and make a vaccine.
Okay, medically, he just spoke gibberish. Getting the mitochondria, the energy center of the cell, not the powerhouse of the cell, will not allow you to create a vaccine. If you want to create a vaccine, you create a protein on the surface of it, then you put it into the body and allow the immune system to recognize it. You know, the way that we traditionally make vaccines. I don't know what he's talking about.
Look, there's Carl's brain.
Where? I don't see it. Is it behind that walnut on a stick?
Your brain is a lot bigger than that.
I got people inside me.
Why, whenever they do medical procedures on cartoons, they like strap people in like it's a torture device? All right, they just traveled into the stomach. So right away, if this was to happen, the acid would melt their little inflatable raft here, and they would fall into the acid and lose their lives. Which is why, by the way, drinking alkalized water is complete horse poop. The reason I say it is because when you drink the alkalized water, that means it has like a pH of 8 instead of 7. It falls into your stomach acid, which has a pH of like 2. What do you think happens to the pH of 8 when it mixes with a huge container of pH of 2? No longer alkaline.
Well, where to next, Douglas? The mountains? The Arctic?
I feel like these are the current devices we have now. You hop on a Peloton, and it's like, where do you want to ride? Through what trail? And to me, like, I understand a lot of people don't have time to go outside or the weather's not cooperative, but like, folks, spend some time outdoors. It's cool too.
No.
You need to start out slow, Doug. See, the important thing is not to strain yourself.
Amazing advice! No joke. In a cartoon. Right now, I had to just get back into working out. I used to bench like 255, 285 during my workouts. The other day I was doing 95, and it's okay. It bruises the ego, but it strengthens the muscles.
Nothing like a peanut butter and jellyfish jelly sandwich.
Ew, peanut butter. Oh, that sounds gross.
To help you get to sleep.
And ideally, you don't want to eat too close to bedtime because then your stomach produces all those gastric juices, highly acidic, and then when you lie down and you're parallel to the floor and the gastric juices starts coming up, you get heartburn. Ugh. Smelly fridge syndrome?
The fridge!
No lie, that's how I sleep. I love it freezing. I like to sleep with multiple covers, with a hoodie on sometimes. I actually just got like one of these cooling mattresses. Maybe it's because I grew up in Siberia, and when I was in my mom's womb, I was like freezing all the time, so I want to go back to that. That's why I always sleep in the fetal position.
Don't be silly, Gary. I don't get colds. I get the suds. No, Gary. If I had the suds, I'd have bubbles coming out of me.
Oh no, he has the suds. Grandma was right to a degree. If you go outside and your hair is wet or you get a chill, it doesn't mean that you're gonna get sick. It can just make you a little bit more susceptible than you were before.
Hey, SpongeBob.
I'm sick, Patrick.
I'm gonna go ahead and guess that he has adenovirus, because you know, he has the conjunctiva that's inflamed, he has the upper respiratory symptoms. I don't know if he has diarrhea. I mean, he probably doesn't have diarrhea because he's a cartoon sponge after all. But if a cartoon sponge was to have diarrhea and inflamed conjunctiva and upper respiratory symptoms, adenovirus.
I know a guy who knows a guy who went to the doctor once, and the doctor's office is a horrible, horrible place.
It is not. We have fun there.
Well, first, they make you sit in the waiting room.
Is that the horrible part, Patrick?
No, it gets worse. They make you read old magazines.
I don't know why that is. Can we update our magazine collection in the medical offices? For God's sake, who wants to read about People magazine from 2006? I mean, we know Britney was killing it back then, but we want to know what's up now. Is that the year she was killing?
Then the doctor pulls out his stethoscope. It's a device so sinister, so icy cold when it touches your bare flesh, it...
Honestly, the cold stethoscope is one of the meanest things a provider can do for you. Every time before I make contact with the patient's chest and or back to listen to lungs, I do one of these. And I get some of the warmth of my hand onto the stethoscope. It's the least you can do for your patients.
You gotta help me get better, Patrick. Please.
I'm so excited to see what Patrick's about to recommend. If he says Manuka honey, I might give the starfish a high five. I have been a doctor for like 7, 8 years. Medical school, 4 years. I do not know what that thing is on Patrick's head that doctors used to wear back in the day. It doesn't make sense. It reflects light. It has a hole in the middle. I have no idea what it is, what it does. I've even worn it as part of a Halloween costume. Oh my God, I actually look like a doctor.
It appears as though we'll have to plug up these holes. This ought to do the trick. Voila! Feel better?
I don't know.
Well, I'm gonna do a hyper-analysis here. See, what's happening is instead of treating SpongeBob's core illness, he's treating the symptoms only. If this is a viral illness, that's a perfectly acceptable way to go about it, to allow the immune system time to heal, to rest, to improve itself. But if it's a bacterial infection, we're missing it. We're treating symptoms and not treating the underlying cause. Could be a big cause for concern there, Patrick. My lawyers will be in touch, or as my legal eagle friend says it, I'll see you in court.
I'll see you in court.
Feeling better yet?
Not really.
Why did he pull out his tooth?
How about no?
I don't think so.
Actually, you may think this is silly. This is something we sort of do in the hospitals. It's called chest physical therapy. If a patient has a lot of mucus, we actually have specialized beds that perform this like thumping feature that helps clear out the mucus. In patients who have cystic fibrosis, we actually need this type of chest physical therapy to be done on a regular basis in order to help them expel that mucus and prevent blockages in the airways. Kind of crazy that SpongeBob has some level of medical accuracy. Who knew?
It seems you have the suds. Are you ready for your treatment?
The doctor's wearing the thing again. What is that thing? What is it doing? And why is there a fish anatomy in the background when there's a sponge patient? Different species.
Well, it looks like your gluteus maximus has made a full recovery.
Oh, his gluteus maximus. They're using proper anatomical terms. I guess he tore a muscle in his buttock.
Your butt's all better. It's really quite amazing.
I love that they did an x-ray. First of all, you can't x-ray a gluteus maximus. You can't x-ray muscles. You can x-ray bones, joints, but not muscles.
It took 20 hours to put it all back together. We actually ran out of staples and had to use a glue stick.
There is a fact here. In closing skin, there are both of those options. For example, if you get a cut on your skull, you could actually close it with staples. It works quite well. If you get a small cut on your hand, we have skin glue that can keep it together. Isn't that cool? SpongeBob, what's up?
Ah, Doctor. Thank goodness you're here.
They're wearing the thing on the heads again.
And what seems to be the problem today? My throat hurts!
Why is this patient admitted inpatient into a hospital for a throat ache? With, again, a chart on the bedside that looks like a stock market chart more than it does an EKG. What even is that?
I'll need one medical sea chicken.
What's a medical sea chicken?
Hey, my keys! And my throat feels better.
He's not a doctor of humans. He's a vet because they're in a fish tank or at the bottom of the ocean. And there's a catfish that ate some keys and didn't have strep throat, but had key throat!
You solved that one. Subscribe.
Key throat! Oh no, little laryngitis.
Oh, those tonsils are really enlarged, Gerald.
Oh, tonsillitis.
I think we should take them out.
Now we're trying to move away from doing tonsillectomies. We're weighing the risks versus benefits here, and we have like a set of guidelines that we follow. If you have X number of strep throats or tonsillitis or pharyngitis, that we get you set up with an ENT who then makes a decision whether or not they need to come out. Now we're trying to do our best to manage it medically and not have to resort to a surgical operation if we don't need to. That doesn't mean you won't get surgery. I'm just saying there's options on the table.
What am I gonna do, Arnold?
Maybe if you gargle or something.
Gargling is actually not a bad option. Also, honey. You know I love my honey.
Are you having problems with your you-know-what?
No, my giggly gland is fine.
His what gland?
No, it's not. Cosmo's fagiggly gland is...
Fagiggly gland! I wonder what the fagiggly gland is.
The special magical organ in a fairy's body that allows us to change shape.
What?
Is Cosmo sick?
Let me put this to you in terms Cosmo could understand.
Yes! Why does the doctor keep putting the glasses on, taking them off, and why is the stethoscope floating? I need and he's wearing that thing! What is that thing? Oh no, Walking Dead again? Why are they all jaundiced?
What the? It looks okay. 986 degrees.
98.6 degrees, normal body temperature?
This morning, our house became infested with an acute febrile contagious virus.
Ooh.
Or as it's known on the street, the flu.
Ooh, the flu. We haven't been seeing much of that lately.
With 13 louds packed into 1,200 square feet, when someone gets sick, it spreads like the plague.
That's true, actually, in like college dorm rooms, military barracks. Anytime you have people living in close proximity, it's very easy for one person to get sick and then get everybody else sick.
In case we're attacked, this concoction will slow down the infected.
What is it, boogers?
Tastes like chicken soup.
Oh.
That's because it is chicken soup.
I would be just shooting that in my mouth all day. I love chicken soup.
They won't let go! Help!
Stop
Stop making so much noise. It's just a purple pentapus.
Oh, it's a purple pentapus. I've never heard of a purple pentapus. I don't know why this popped into my head. If you ever heard of molluscum contagiosum, it sounds really serious, but it's not really that scary of a virus that causes like these little skin pearly papules to pop up. It happens more often in kids, people who share towels. Sometimes they're sexually transferred. I like when they just like rub them like that. And they just pop right off. Morgan School.
Good morning, class. Good morning, Miss Pancreas.
Miss Pancreas.
Miss Pancreas? Yes, bladder?
That doesn't look like a bladder. That looks like a lemon.
Can I go to the bathroom?
And ironic that the bladder has to go.
You'll have to wait till after roll call.
Oh my God, this is so embarrassing. I remember in like 2nd or 3rd grade, I asked the teacher to go to the bathroom and she said no, and I peed myself in class.
She eats like a bird. She barely leaves the house.
I am not depressed, Mom.
She's reading the same book over and over.
She's depressed.
I'm not depressed.
Okay, no one should make decisions for you to say whether or not you are depressed or aren't depressed, especially if you're clearly stating that you're not depressed. We use objective tools like the PHQ-9, which is a scale where a patient answers questions about their current state of mental health, and from there we can make a diagnosis.
I may switch you to Zoloft or Lexapro, and twice a day instead of once.
This is just not the way a doctor's visit surrounding mental health or even depressive symptoms should go. It should be more of a conversation with just the patient and the doctor. The mom should leave the room. It's about getting an intimate knowledge of the patient's situation, how they feel, what's going on in their lives. Are they having any negative or distorted thoughts that are really destroying their current feelings?
Have you been going to that support group I suggested?
Yeah, it's not my thing.
Support groups can be a great way for you to connect with people who are...
What?
On the same journey.
Support groups are a very positive thing. A lot of times when you're feeling down, depressed, having some sort of distorted thoughts, what ends up happening is you feel alone. And by going to a support group and seeing that other people are going through something similar that you're going through, perhaps sharing their stories of success or even stories of difficulties, that connection, that sort of hive mentality that gets triggered actually helps release some positive neurotransmitters, release some endorphins, allow you to feel closer to other people, thereby decreasing the severity of the depressive symptoms.
I'm Hazel. Thyroid originally, but now with quite the impressive satellite colony in my lungs.
So what she's saying is she initially started having thyroid cancer, which then metastasized, meaning spread, to her lungs, thereby necessitating the oxygen that she has in the nasal cannula there. The most common types of thyroid cancers are actually very benign. The 5-year survival rate is quite high in them. And the most serious thyroid cancers, while they're the rarest, are some of the most devastating cancers that you could develop in the human body.
And that was my life. Reality shows, doctor's appointments, 8 prescription drugs 3 times a day.
So the big problem with taking a lot of medications like that is basically polypharmacy. There's a lot of interactions that happen, and when you have interactions, you have side effects. So you're nauseous, you're fatigued, your muscles ache. All these sort of side effects are almost needed in order to battle off this cancer, or at least give you a longer time here on Earth. So it's tough. It's not an easy journey. I've witnessed it firsthand with my patients and obviously with my own mom, who unfortunately lost her life to cancer, but it's a difficult journey. If you ever had a loved one that you took care of or witnessed battle cancer, you know how hard it is.
Hey guys, hi, I'm Isaac. I have retinoblastoma. We had surgery on one eye when I was younger.
Retinoblastoma is a type of cancer of the retinal area of your eyes, which is like the light absorbing portion of your eye, the posterior portion of the eye. It can be diagnosed with a proper light exam. When we shine the light on the eye, we actually see a red reflection of the blood vessels. But if there happens to be a tumor blocking that red reflection, you actually see a white reflection of the eye. And that is a serious, serious risk that needs to be further investigated for retinoblastoma.
I'm Augustus Waters. I'm 18 years old. And I had a touch of osteosarcoma about 1.5 years ago. So I lost this baby as a result. And now I'm part cyborg, which is awesome.
Prosthetics have come really far over the last 20 years. Not only are we starting to send feedback to the prosthetic from our brains in order to control them better, we're now working and experimenting on getting sensory feedback from the prosthetic back into our brains. And if that happens, that's going to be absolutely revolutionary.
Really? That is disgusting. Ugh, you were doing really well, too. God.
There's always a Hamartia, isn't there? And yours is, even though you had freaking cancer, you're willing to give money to a corporation for the chance to acquire even more cancer? Let me just tell you that not being able to breathe sucks.
It does, and a lot of people think that smoking increases rates of lung cancer. While that is true, you're not definitely gonna get lung cancer by smoking. What you will get is decreased lung function. What you have a mega high chance of getting is emphysema, COPD, true problems that are detrimental to life quality. Imagine losing the ability to take a full deep breath at age 40. Do not smoke.
I never lit one. It's a metaphor, see? You put the thing that does the killing right between your teeth, but you never give it the power to kill you. A metaphor.
That's what you got, buddy. That's your pickup line. How's that working out for you? A wet, loose cigarette in your mouth. Delicious.
The most important thing in any MRI is to lie completely still. But that day, it was almost impossible.
Yeah, it's really hard to lay still, and you need to lay still. It's also super loud, uncomfortable, claustrophobic in there. I've gotten a couple MRIs. It's brutal. And if you have to get multiple MRIs over and over again, they gotta find a better way.
And then this happened.
Oh no, is she febrile? Looks like a fever. She's very sweaty, night sweats. Common symptom, common side effect in cancer is night sweats. That's why if you ever go to the doctor and we have some symptoms that we don't quite understand, we ask about night sweats and unintended weight loss. All right, so we have a pulse of 112, oxygen saturation of 97 with a blood pressure of 127/80, which is acceptable.
Fluid in the lungs preventing oxygenation. They put a tube in. Drained like a liter and a half last night.
Chest tube from a pleural effusion. The space that surrounds your lungs can sometimes be filled with fluid, whether from a cancer or from an infectious process, and as a result, it makes it very hard for the lungs to expand, causes you to be hypoxic, and vital organs start suffering very quickly.
Normally, the tumors start resisting the treatment, and that hasn't happened here yet. On the other hand, the drug may be worsening the edema.
Truth is, very few people have been on phalanxa for as long as Hazel has. We really don't know the long-term effects.
What we're trying to do is prevent endothelial growth.
Endothelial growth is basically blood vessel growth. So the tumor starts expanding, creating new blood supplies, thereby feeding itself.
So I had a PET scan. And it lit up like a Christmas tree.
That's a scan essentially looking at metabolic activity in certain parts of the body. It will light up like that.
Are you in pain?
No. I'm okay.
Cancer-related pain is one of the worst types of pain. That's why some of the most powerful pain medications are used in cancer care. You think of why fentanyl was even developed. It was specifically targeted for cancer-related pain.
How's he doing?
He's had a tough night, Hazel. His blood pressure's low.
So in a situation like his, I don't know if he's struggling with sepsis that can cause a low blood pressure. Also cardiogenic shock if he's having congestive heart failure, but all of that can contribute to a low blood pressure, which obviously you can fix temporarily by giving fluids, blood transfusions, pressors, but at the end of the day, unless you treat the source, it's never gonna go away.
They're gonna stop the chemo.
Sometimes that's an important decision to be made when you see that treatment no longer has the benefit that you want it to have. It's actually impeding on quality of life. Therefore, it's not worth extending the quantity of your life, the amount of time you're around, if the quality of life is so poor and unacceptable to the patient. So it's a very important decision that needs to be made as a group, as a family, a lot of times with the help of a mental health specialist or even a hospital palliative care specialist.
One of the first things they ask you in the ER is to rate your pain on a scale from 1 to 10.
So originally the pain scale was created in order to make sense of a subjective feeling and to make it more objective. So we can qualify the pain, so we can see if a patient is improving, so that we can create a guidebook of what we expect patients to feel with certain conditions.
You don't get to choose if you get hurt in this world, but you do have a say in who hurts you. And I like my choices. Okay, Hazel Grace?
Okay.
It's such a Romeo and Juliet story.
Is it Romeo and Juliet?
They both die together.
Well, but they kill themselves.
But she's laying kind of about like she's gonna die, like she's giving in to the cancer to be with him.
I guess so. Maybe that's the ending. Maybe she dies right there.
Isn't that what is happening?
That was never my read on it.
Wait, is that the official end of the movie? Oh, yeah, I think that's my read of it. That like she was battling cancer, now she's like, all right.
Ah, hot read.
A lot of my patients come in and say they have a fever because they're running 99.5, but that's not a fever, technically speaking. You are hot though. Mommy cusses. Found out at my doctor's appointment that the disturbing voices I've been hearing nonstop are called children. Bill Murray? Did Bill Murray tweet this? I hate when I'm on the treadmill and my hand accidentally hits the stop button and I have to get off and eat a bacon grilled cheese sandwich. Don't hit the stop button. Unless it's an emergency, of course. And don't get a bacon grilled cheese sandwich. First date, her. I'm really only interested in inner beauty, me. Oh, I see. Second date, me. So I scheduled us for colonoscopies. That's funny. That's not the inner beauty that you want to see, because I will tell you, unless you do really good colon prep, which means drinking that stuff that makes you clear out, the colon is not a pretty place to be. Taming Fred Savage. I don't know who Fred Savage is. Me. Donating body to science. Science donates my body to Goodwill. That's not how it works. First of all, everyone should, highly recommended by me, become an organ donor. All the myths out there about doctors not caring about you because you're an organ donor and they'll let you die, it's all nonsense. Nonsense. When I'm working in the ER, I have no idea who's an organ donor and who's not. Only once the patient passes do we even begin to look for that information. And we don't donate the bodies to Goodwill. I found out it takes 42 muscles to frown, so I went ahead and canceled my gym membership. I don't know if it's 42 muscles, but I know it takes more muscles to frown than to smile. That's why I'm always smiling, because I'm lazy. Rodney LaCroix. I wonder if he owns the water. Rich? Doctor, do you exercise? Me, yes. Smoke? No, never. Drink? Yes. How often? 4 kids. Heavily. Got it. I long and love for those honest conversations. As a family medicine doc, you're talking to someone who's stressed out. They're not so excited to be at a doctor's office because they have a million other things to do. But you just have this like connection where they tell you about their life, you understand their struggles, you help them, you try and make their life not only a little bit healthier, but a little bit more fruitful. So they get more out of it. They give to the world, they give to themselves. Genetics lab, me. One designer baby, please. Doctor, it's not like that, you. Me, please remove the pooping and crying functions. Doctor, what? No, you can't. Me, give it wings and flamethrowers. Doctor, Me, I'm gonna call her Claire. It sounds like they're building a transformer more than they are making a designer baby. That is literally not how it works. Your baby will need to cry, your baby will need to poop. In fact, if it didn't have those functions, you'll have a bigger problem with your baby. Just saying. Maybe I took that too seriously. You know you're a nurse if you've been telling stories in a restaurant and had someone at another table throw up. I think that's just like being in the medical professional in general. Sometimes I'm telling stories to my friends and they're like, Mike, we're eating. And I'm like, true. Poop jokes don't work when you're eating dessert. Jesse, doctor, do you exercise? Me, thinking of the arm curls to get the chips from the bag to my mouth. Yes, daily. If you actually do like a strong isometric contraction right here, that could be exercise, but I don't know many people who eat chips like that. If you do, why? On shell, at a doctor appointment, step up on the scale, jokingly. Do I have to? No. What? How have I gone this long without knowing this was an option? I mean, everything when you go to a doctor's office is an option, unless you're going for like a work physical or some kind of clearance. But in general, when you go, you have a patient bill of rights. Anything you don't want to do, even though like we'll try and recommend why you should do it, you don't have to. That's like the beauty of medicine. We work together as a team. If you're uncomfortable with something, maybe don't say, I don't want to do it. State that you're uncomfortable and perhaps hear the doctor's explanation of why it's recommended. You never realize how squeaky your shoes are until you walk into the room of a sleeping patient. Nurse problems, nurse life. I don't know what it is. Hospitals are extra echoey. Why? So I got a text from the doctor asking if my crap was properly hydrated. Turns out he actually wrote CPAP, and no, I'm not not adjusting to bifocal as well. For those of you who don't know, CPAP is continuous positive airway pressure. It's the thing that people wear around their nose at night. It's like a big contraption that lays at the side of their bed. It basically keeps your airway open so that when you have sleep apnea, your airway doesn't collapse and you wake up like snoring because you actually weren't breathing. It's not so comfortable to wear, but I will say there are things on the horizon to make this whole process a lot smoother. I feel like a pizza party should refer to pizzas having a party. Oh, wow. Humans having pizza at a party should just be a party with pizza. Does that make sense to you, therapist? I think we should meet more often. I think that is natural curiosity that makes you eccentric and fun and interesting to be around. Maddie MSN. You know it's gonna be a hashtag bad day when the scrub machine gives you 2 pants and no shirts going shirtless. For those of you who don't know, there are now like Scrub X machines, I forgot the name of the brand, where you literally punch in like your employee ID or scan your badge and it feeds you your scrubs for the day. You could put them on. But sometimes they make mistakes. They give you wrong sizes. Sometimes it gives you 2 pants and no shirt. And that's a struggle because to get it fixed, like you need to go find someone, and if you're busy and it's a shift, hey, do you want to hang out? Sure, I'm free October 32nd, 2051. Let's plan something for then. Med student problems. Oh my God. I remember when I was on the ICU block and I would be working 6 days a week. Call Q2, which means every other day, means you come in at like 5 a.m., you leave at 9 p.m. every other day. Just like imagine how brutal that is. You have to wake up at like 3:30, 4, get to the hospital, work all day, get home at 9, wake up again super early. Like all you did was work and sleep during the ICU block. Your friends were like, where did you go this last month? And you're like, ICU. They're like, you see me? No, ICU. Intensive care unit, JK. Oh, get it? JK. 9 out of 10 doctors recommend a diet rich in lean protein and vegetables, and 1 out of 10 doctors is a stakeholder in the bariatric sleeve. For those of you who don't know, by the way, bariatric sleeve is a surgery that you can get in order to shrink the size of your stomach, which basically encourages you to not eat so you lose a lot of weight quickly. Other names for this is a stomach bypass, stomach stapling procedure, gastric bypass, all sorts of names. But these types of bariatric surgeries actually have really good evidence working long-term. For those who are really obese, I'm not talking about if you're 10, 15 pounds overweight. I'm talking morbid obesity, where the obesity is presenting an imminent threat to your life. CT scan. Patient. Doc, you're sure this is safe? Just a little radiation, right? Me from a mile away behind some bulletproof glass, a wall that's 45 feet thick, and a full suit of lead. Please hold still. Now look, CT scans absolutely expose you to a dose of radiation. The benefits of getting a CT scan in an emergency or when there's a true medical condition that we're trying to evaluate are outweighed by the risks, meaning that it's more beneficial to do the scan and expose yourself to some potential radiation. That being said, doing CT scans unnecessarily is really bad. And as a patient, okay, you'll get 1 CT scan, but as the doctor or the tech that's doing the exam, you're doing dozens of these a day. So you'd be exposed to a ton of radiation. So you better get 45 feet away by a 45-foot wall with a suit of lead. Doctor, how do you practice self-care? Me, pillows. Doctor, pillows? By sleeping on them? Me, no, by screaming into them. You know what? I wouldn't even judge. One of my patients came in and they said they get a lot of happiness or their emotions out by screaming into a pillow. That's awesome. I think I get a lot of my anger out and work out my issues when I'm like punching a punching bag, you know? And to each their own. There is a surprising lack of YouTube videos detailing how to perform self-surgeries for inguinal hernia. Yeah, because you shouldn't perform surgery on yourself. It's really that simple. There was a story of a doctor who performed surgery on themselves in, I think, like Antarctica, because there was no access to medicine, and he performed an appendectomy on himself. I'm gonna tell the story in a video, because like it's a crazy story and you gotta hear it. If you're down, let me know in the comments. No idea daddy blog. 5-year-old, where's the scissors? Me. 5-year-old, I'm playing doctor. Dog is adorable. First of all, nobody wants to hear it. They ask you being polite, but then if you start telling them about your anatomy lab, your OMT lab, your boards that are coming up, people are just like, doctor, can you show me where the pain is coming from? Me, shows a text that has been seen with no reply. If I'm struggling in a relationship, I would just show a text from my ex and I'll be like, sadness? It's probably better that Doctor Strange became a superhero because his sterile technique is cringeworthy. Oh, I'm excited for this.
Strange. Strange.
Oh, did he touch his face mask after washing? Doctor Strange, That is a no-no. Some girl at my college came to the chemistry lab wearing flip-flops. The instructor made her do this. Always use protection, folks. And I'm not talking about condoms. Well, I am talking about condoms, but I'm also talking about your feet. If you spill hydrochloric acid, you will burn your foot. Your feet. Do not burn your feet. When you cannot mentally take in any more information, so you resort to physically transferring it. Doctor, I've got some bad news. Me. Lay it on me gently. Doctor. Okay, knock knock. Me. Who's there? Herpes. Here's the deal with herpes. You shouldn't try and get it, but if you get it, it's not the end of the world. A lot of people think herpes is some sort of deadly illness. For the huge majority of the time, it has no bearing on your life, outside of some discomfort or physical symptoms or a rash popping up. When surgery turns up the jam in the OR. Yo, surgery room gets lit. $50 to walk in the door, prescribes green tea with lemon and honey. I just paid a copay for you to tell me to drink honey? My grandma told me I can have honey. What did you go to school for? I just saved you unnecessary antibiotics that had you have taken unnecessarily for your viral illness, you would have then developed diarrhea down here, possibly a rash up here, possibly anaphylaxis in here, which means your throat closes and you end up putting on gloves, alone, in front of other doctors. When you're alone, your palms aren't sweating. When you walk into the surgery room, the OR, as a new student and you haven't been there a lot, your palms just start spraying sweat like it's sprinkler fluid. Sprinkler fluid? I remember when I was a resident and I was nervous doing a procedure and I was putting on the gloves in front of a patient. It looked like it was my first time putting on the gloves. The patient was probably like, dude, this guy doesn't know how to put on gloves. I'm not getting sick during my peds rotation. I remember I'm on peds in the hospital and I'm doing my rounds and I'm all cheery and I'm like, okay, little baby, say ah. And just as they say ah, the baby goes right into my mouth. I tasted the baby's saliva and they had Coxsackie. It's a virus. Ugh. Doctor, his palms are sweaty, knees weak, arms are heavy, there's vomit on the sweater already. Did you just quote Eminem? Ma'am, your husband's alcohol problem is not a joke. But on the surface, he looks calm and ready to drop bombs, but he keeps on forgetting what he wrote down the whole... Okay. Oh yeah, didn't James Charles just... Yo, James Charles got demonetized for some craziness for singing like womp womp womp. Yo, M, please. We have a lot in common. I'm from Russia, you're from Detroit. I'm white, you're white, you rap, I don't. Don't demonetize me, bruh. When your attending gives incorrect instructions, but you really want a letter of recommendation, you have to figure out a way to tell them that you don't think it's right or what you've read is wrong. Trying to learn a new skill in medicine,
okay,
like...
hand up for you, okay? Let mommy go. 2, 3. Feet up.
Go ahead, Win.
Okay, now Winston goes and you wink.
Go ahead, Deke. Oh, shit.
Open up, please. Me. Sometimes I get sad. It's really funny. I like this one. This one makes me happy. I don't know why. But yeah, it's okay to get sad. You only appreciate the sunrise when you've seen the sunset. Me. I think I have cancer. Doctor, it's all in your head. Phew. A bunch of tumors all in your head. Yeah, that's a meme. Your patient drinks, smokes, consumes 6 cups of coffee daily, has diabetes, high cholesterol, BMI of 40, BP 160 over 110, doesn't adhere to his meds, but it takes a daily multivitamin. Why are you still alive? I don't know if any of you have ever heard of House of God. It's a great book, Samuel Shem. It always talks about the unhealthiest people living the longest. It feels like they never croak. Their blood pressure is poorly controlled, they're overweight, they don't take their medications appropriately, but then they're like, oh, but I take my Flintstones daily vitamin. When you scrub in for the first time and walk up to the operating table like, I'm not sure what to do with my hands. Honestly, it's true because you have to keep your hands like this, or like this, or like this, because you can't drop them too low because that area is not sterile. You can't put them on your face because that's not sterile. So you have to like keep everything like this. And if you sneeze, you have to sneeze forward. The worst thing that you can do is turn to the side and sneeze, because then all the sneeze particles comes out onto the patient from the side of your mask. Texas, 14-year-old virgin falls pregnant after flu shot. Hell no. Why myself or my kids will never get the flu shot? one of the many reasons. What? Unless you're dating a guy and you've nicknamed him Flu Shot, ain't no way a flu shot's getting you pregnant, baby boo. Nurse, you may not feel anything from the waist down. Him. Just then? What? Oh. I would have written this meme as, you may not feel anything from the waist down. And I want to say as him, wanna bet?
You are the mother. You are great. You are magnificent. You can do whatever you want to do in this world. Get your mother shine on today because you can.
I'm officially changing my alarm clock to that because we all need a little inspiration in the morning. This isn't just for healthcare workers. Many top scientists are on the autism spectrum. So technically, autism causes vaccines. What movie is this from with The Rock? This looks old school, but yeah. No, it doesn't! Mike, carbs are bad for you. Also, Mike eats Kinder eggs. Dude, keto for 30 days with no carbs, no sugar was tough. So when I finish keto and I get a package of Kinder eggs, you best bet I'm gonna go in. So do you like touch my balls first or how does this work? Steven, I'm your dentist. Hold on a second, this picture is not accurate. Why does he have the stethoscope? Doctor, it's okay, your wife's in a better place. Heaven? My apartment. Oh my God. When the parents refuse all vaccines and the newborn screening because they're all natural, but then demand a circumcision. I love this guy's meme face. I don't know what's been going on with circumcision lately being in the news. Everyone's talking about it. There's a huge uproar. There are health benefits to getting a circumcision. There are health risks to getting a circumcision. The health benefits are pretty few and far in between, but if some people for religious reasons want to get one and there are some health benefits, we do them. Let's make a circumcision video. No, wait, that sounds bad. Let's make a video discussing circumcision. I pass this every day and it always seems like someone caught in a lie. Where do you work? Oh, the medical building. Oh, what's the address? 12345? Geez, what do you do there? It's the surgery center. I didn't even see the 12345. That's crazy. Sure, you're a doctor. Then how do you explain all your free time? That's a question I can relate to. Making YouTube videos, going on television. I mean, Ryan Seacrest the other day was like, are you a real doctor? Michael Strahan's like, are you a real doctor? Yes, I'm a real doctor. Board certified family physician here. What's up, yo? Other student, how are rotations going? What I say, living the dream. What I mean. Doctor, any drugs? Patients in the ER? Nope. I'll have young folks come in and they look like they just came from a rave concert, from Ultra, Coachella, Burning Man, whatever it is. And they're like, I don't feel good, doc. And I'm like, well, tell me what's been going on. What'd you have? Oh, I just came back from this concert. We were raving all weekend. Well, did you do any drugs? No. Did you drink any alcohol? No. Tell me, let's talk about it. How can I help you if I don't know the truth? Vaccines cause adults. I'll take all the immunity you got. Thanks, fam. I would wear that shirt. Vaccines cause adults. You know what's funny? I could totally see an anti-vax person seeing that, be like, oh my God, you believe in that too? When a patient's blood pressure is off, so the attending asks you to take it manually, thinking it'll somehow be more accurate. Aw, it's so easy to check blood pressure. You should know how to do it. Do not lose your art of the physical exam. Do you need another stool sample, doctor? I didn't even ask for the first. Doctor, your wife is pregnant. No, she isn't. I was wearing a condom. Yeah, but I wasn't. Why are all the things about doctors cheating with their patients' wives? I don't understand. Ask yourself, is she actually thick or is she just suffering from lumbar lordosis? Whenever you say lordosis or kyphosis, that's actually the curvature of the spine. And if you have extra kyphosis or extra lordosis, it accentuates that curve. Doctor, you're gonna be a vegetable for the rest of your life. Patient, I'm vegan, so that's amazing. Speaking of vegan,
34-year-old Nikki loves to eat cornstarch all day long.
Cornstarch is really nutritionally empty. Calories from carbohydrates, that's it.
Cornstarch is normally used for thickening, baking, but me personally, when I buy it, it's strictly for eating it.
Interesting.
My first craving for the cornstarch started when I was pregnant 16 years ago. Most women, when they're pregnant, they normally crave like pickles and ice cream, things like that, but my craving was cornstarch.
There's a condition called pica that basically creates cravings of eating all sorts of things. I've seen patients eat mud, dirt, sand.
My son, Marquise, he was 4 years old. He passed away 4 years ago due to a seizure. Since Marquise has been gone, I did start eating cornstarch more than I normally was.
There's some kind of psychological coping mechanism going on here. People find pleasure and safety in all sorts of aspects of life. Sometimes it could be a safety food that reminds someone of how they felt during a safe moment in their lives.
Oh, hi there.
What you got there? Whoa!
There was absolutely no need to catch her like that. That's so ridiculous and so obviously staged and getting me so obviously angry.
It's like smoke everywhere.
Oh,
I'm a psychotherapist specializing in disordered eating and addictive behaviors.
I'm JJ Virgin. I'm a certified nutrition specialist and a certified health and fitness specialist. How often are you having bowel movements?
Maybe once a week.
yeah, that could be as a result of not hydrating enough or perhaps having low fiber. Again, you can't jump to that conclusion without doing a full evaluation of the patient. And I'm sure the show will do just that.
JJ and I pulled the cover off this pool to reveal the amount of cornstarch mixed with water that Nikki eats in a year. This is 1.5 feet deep.
These visuals piss me so much off. I just refuse to believe that there's evidence saying that if you show someone how much they eat in a year, it has any impact on their behavior.
What do you think's gonna happen if I walk on this?
Sink.
Are you asking that genuinely?
Wow.
If you walk fast, you can walk right across it.
And I don't understand how this is valuable to her journey at all, but I completely understand why the producers thought it was valuable for their show. So you know who this show is out to help.
Are you ready to see and experience what 6 months of your
Oh my
cornstarch
God.
looks and feels like?
Are these people legitimate medical professionals that they're doing these things to these patients? Like, this is so ridiculous.
It looked like a volcano had erupted.
Whoa, so cool. It's like a scene straight out of Breaking Bad.
You're goddamn right.
What Nikki was really needing was support and somewhere to go with her sadness. I don't want her to go to cornstarch. I want her to go to her husband. If we take away cornstarch, we gotta add something. And what we need to add
is you running on cornstarch and losing your shoes and then going into an attic and spraying it everywhere.
Is the strength of this marriage is you being able to go to your husband.
When you're hurting, I'm hurting too as well. You have to let me know. You have to be open to me as well.
I'm obviously joking. This is good communication between partners.
I recognize that Nikki's gonna have a craving for cornstarch for a while, and I think tapering is gonna serve her better. We made a healthy rendition of her cornstarch by adding protein powder and fiber powder into it.
At least you're getting some better macros in there with the protein powder.
By day 3, Nikki's urges to eat cornstarch are growing stronger.
But when I do have the urge for cornstarch, I just go to my mixture with the protein and fiber.
This is where the therapy would be very supportive instead of just throwing it on the husband and saying, you solve it every time she's having these emotions. Like, I hate these fake therapy things on TV because it's so disingenuous of how it actually happens. In a situation like this, she would meet with a medical professional who's gonna try and explore why she's having these cravings. What is she thinking about during these cravings? What triggers the cravings to come on? And find actual ways to deal with those situations instead of sitting and making her run across cornstarch with water and then having her sit with her husband and have a great scene for television. Actually help her with mental health counseling. Show what it's like.
Kate's a devoted mum who loves to spend time with her family, but behind closed kitchen doors, life is no walk in the park. Because Kate's diet is almost exclusively cheese.
Not gonna lie, that is my dream. I'm like a little mouse when it comes to looking for cheese.
Because I have that memory of eating it from being a little girl, it's so safe. So I know that I can tolerate it and eat it and it won't make me sick or it won't make me feel uncomfortable.
Well, the thing with cheese is it absolutely can make you sick, even if you don't have a lactose issue. There's all sorts of bacteria that can build up in cheese. Listeria is a common one. And there's been a lot of conflicting data coming out on cheese on whether or not it helps decrease cardiovascular risk or increased cardiovascular risk? Are you getting good benefits from the micronutrients plus probiotics, or are you getting more harm from the saturated fat and overconsumption of calories? It really probably is going to depend person to person.
Sadly for husband Jeff, Kate's fear of anything hot and saucy means his home-cooked specialities are her worst nightmare.
Oh, what? I wonder why.
If Jeff's cooking something, he'll say when it's done, are you going to taste it? And then as it gets nearer, I can feel myself getting really, really anxious.
I wonder if this is some kind of phobia that you can perform maybe guided desensitization on to help decrease these physiologic responses that she's having of nausea.
I'd like you to go and grab one of those suitcases for me, please.
Okay.
Where's she going?
And then unzip it and then tip out the contents.
Oh, cheese.
That represents
how much cheese I eat.
In what sort of time frame?
A year.
6 suitcases worth of cheese is how much you're eating in a year.
What is one supposed to do with that information?
Pixie wants to show her the internal effect of her stodgy diet. She's got 10 meters of tubing, half what's inside the average person. She's prepared 2 liquids. One represents fibre-rich food and the other, Kate's cheesy diet.
Well, that's another good thing to point out, that cheese is usually not rich in fiber. We know fiber to generally be considered a healthy nutrient that you want to make sure that it's present in your diet in order to decrease potentially some risks of disease and slow the absorption of foods and to make you more regular.
I want to get you to transport the fiber-rich food right through the intestine for me. Now, what do you notice about that?
It's running down quite quickly, no problem at all.
Can I get you to do the same thing with the cheesy stuff? Oh.
This is so not accurate of what happens inside of our stomach. It's not just a bland pipe. Our GI system actually exhibits a neuromuscular function called peristalsis, where it literally, through waveform motions of the gut, pushes food along the track. So it is more absorbed and it does move freely. This is obviously just like a silly example.
Head chef Steve Hildebrand has been lined up by Natalie to demonstrate to Kate that the pasta she's terrified of is actually made up of ingredients she's already conquered.
This is this desensitization that I was talking about. This is one way of accomplishing a decreased physiological response to the food.
I'd suspect that that's the largest combination of flavors and ingredients you've ever tasted in one go.
Yeah.
Ever.
Yeah.
I mean, exploring your palate is generally a positive thing to do, because when it comes to eating in moderation, that's usually a healthy strategy.
The floating city of Venice is home to some of Italy's finest restaurants.
Can I have the spaghetti with meat sauce?
Wow.
Thank you.
And I'm not gonna judge the food choices she's making, because that's not my place. The point I wanna make here is that she's incorporating new foods that have different sources of protein, that have different micronutrients, perhaps some more fiber. Therefore, she's gonna get a more well-balanced meal and have a lower risk of developing a nutritional deficiency. Back to the show in just a second, but first I want to tell you about True Classic, a clothing brand that actually fits me. Online shopping for clothes is difficult because most stuff just doesn't fit right. And as a full-time doctor, YouTuber, and dog dad, I just don't have time to go to the mall and shop around. Fortunately, I found True Classic, and now my closet is full of shirts that actually fit my physique. They're a little tighter around the arms and chest to show off those gains, and a little looser around my midsection to make them super comfortable. I literally wear these shirts everywhere, whether I'm out to dinner with friends, at the gym, or even on stage during my presentations. It's not just t-shirts either. They sell long sleeve Henleys, jeans, button-ups, joggers, a ton of great gifts for the guys in your life. Upgrade your closet and shop now to unlock big savings during their huge holiday sale of ultra comfortable, perfect fitting essentials. Just go to trueclassic.com/Dr. Mike to save. Let them know I sent you. All right, let's get back to the show.
26-year-old Daniel drenches all his food in maple syrup.
I got my syrup going.
I put maple syrup on everything that I eat. Breakfast, lunch, and dinner.
It's gonna be a surefire way to increase the sugar content of anything he's eating, which if he's even remotely over-consuming calories in his meals and then adding that on top of it, you're gonna get into a place where you're gonna be putting on weight, and that's the unhealthy type of weight, where the odds are that you're gonna be putting on visceral fat, which is the fat that surrounds your organs and is considered less healthy.
Each and every day, Daniel downs more than 2 cups of maple syrup.
Wow, that's a lot.
That amounts to nearly 2,000 calories a day.
That's how much an average adult should be really consuming, period. And he's just doing that with the maple syrup. And it doesn't look like he's using a high quality maple syrup, which to me doesn't really reflect the true nature of maple syrup, where if you truly tap a tree and get the maple syrup out of it, you're gonna get some nutrients, but in these hyper processed ones, a lot of times what you're gonna get is just processed junk, refined carbohydrates that spike your blood sugar, spike your insulin, create all sorts of unintended, unhealthy effects.
His eating habits are catching up to him. He's not as active as he was. He's not as energetic as he was. The maple syrup is taking its toll on his body.
Yeah, when you're gonna overconsume the maple syrup, what's gonna happen is your body's gonna store the excess sugar as triglycerides. It's gonna deposit itself in your liver. You're gonna have insulin spikes. You're gonna see hormonal changes. And most importantly, you're gonna see body fat increases. And when you start carrying excess body fat, your risk of heart attack, stroke, cancers go up. It really is a detrimental effect on the human body.
This maple syrup here, how long does this last you?
About 4 to 5 days.
Sounds like it's your drug. Sounds like it's...
I won't go that far, sir. I don't even know you, and you shouldn't even talk to me like that, you know?
Yeah, I agree. Even though it's unhealthy, the way this person's talking to them is a little aggressive. Part of having a good physician-patient alliance is being on the same page. And you did not start that conversation off on the same page.
Oh, my Lord.
We used a storage container to stash 912 pounds of sugar, 2 years worth of what he's eating. Yeah,
So-
2,000 calories a day of sugar that you're downing.
Who talks like that to a patient? The food that you're downing. Who are you?
It's a lot of syrup.
We've set up 2 years worth of Daniel's maple syrup.
No, what you should be saying is we wasted 2 years worth of maple syrup to set up a stunt for this camera.
We actually want you to pour every single one into that trash.
In the era of wasting food, this is so terrible.
I don't know why you guys are wasting this much syrup. That's crazy.
It's trash.
No, it's not. It can totally be used as a sweetener appropriately. Overconsumption of it is unhealthy, but the judgment that's coming from these supposed two mental health professionals and nutritional specialists is really upsetting. I would have loved to see the mental health specialist, this Dr. Mike character, step in and say something about this and call it out that this isn't healthy.
The real shocker came when I looked at his body composition. You have 42 pounds of fat on you.
She says it so judgmentally, it's insane. 42 pounds of fat, like what does that mean? Give me a body fat percentage. That's the real value of what I wanna know. And that's a body impedance scan. They're not super valuable. It's slightly better than, let's say, just doing a BMI for the average person.
You should be sitting there, honestly, 8-9% body fat.
Excuse me? Excuse me. 8-9% body fat? What is he, a bodybuilder?
I gave Daniel this information, and I think he heard it, but I wanted him to really feel just how out of shape he really was.
I'm gonna make you feel terrible about yourself, and that's gonna help you get better.
Come on, up. Let's go.
When JJ made me do sit-ups, I knew that I have a problem.
They're forcing him to say that.
Daniel didn't even make it a minute. He was sweating, he was struggling.
That's what exercise is, since you've clearly never taught anyone exercise.
That is peach salsa.
That is good.
Now Daniel has some alternatives that have 1/8 of the sugar of his maple syrup that he can use to push maple syrup out of the way.
Well, that's a good alternative. I'm okay with that. That's making progress in the right direction. At least it's a little bit of a practical step that he can use, as opposed to, hey, you suck at exercise.
We wanted to show him somebody who was young, who had kidney failure, and now he spends 3 days a week, 4 hours at a time at this dialysis clinic.
Mikey, how old are you?
I'm 36.
Why does Mikey have kidney failure?
We wanted Daniel to understand that by the time he started to feel bad, it could be too late for him.
Are they saying he's gonna develop type 2 diabetes and then not control it with medications and then develop kidney failure? It's so much to the point where he ends up being on dialysis? I mean, this is so strange.
Dan, you look a little freaked out.
I don't want to see this.
The sooner you can make a change, the better.
This is so awkward and wrong.
I could be in this situation a couple years from now. I don't even know how I would adjust to this.
Why are they shitting on this poor guy's life? We don't even know why he has kidney failure.
And when we met you, you were eating a gallon of maple syrup a week. How much are you eating now?
quarter at least of a gallon.
Daniel has cut down his maple syrup consumption by 75%.
That's moving in the right direction for sure. They're such assholes, though.
36-year-old Misty drowns everything she eats in tartar sauce. Every meal, every day.
This show feels so exploitative?
Exploitative.
It's so bad that it's both.
In just tartar sauce alone, Misty consumes a mind-boggling 14,000 calories a week.
That's a lot of calories. That's 2,000 calories a day. People think that this is a physical issue, but it's actually a mental health condition that's driving her to feel this way about the tartar sauce.
Eating tartar sauce is almost like having an orgasm.
Wow. I've never heard anyone discuss tartar sauce in that way. Tartar sauce isn't even considered an aphrodisiac. Not that any of those aphrodisiac things, by the way, make any medical sense.
Tartar sauce in your purse, Missy? Really?
I don't know how they got there.
Open that truck.
They have to do the visual every episode.
Oh,
there's another one.
Wow. Look at
Oh,
this.
I thought they were gonna fill up the truck with tartar sauce.
For real?
Yep, for real.
People have legitimate medical issues, and this is how they treat it.
We're gonna send a year's worth of tartar sauce rushing towards you right now. Are you ready? Here it comes.
This is so sick.
Just to see all that ooze and goose sliding down the slide, it even grossed me out.
It's all the fat in that tartar sauce.
This is, ooh, no.
If there was a shortcut to creating an eating disorder, it's this.
What do you see?
Heavy-set woman.
You're obese and most likely at this point morbidly obese.
The fact that you say that with a scowl makes you a scumbag.
This could be as bad as it gets, but if you keep going. We had created a picture of Misty with about 50 more pounds on her.
Did they Photoshop her to be bigger? Are you trying to create a body dysmorphia? If I was in this producer's room, I would tear these people apart.
Tartar sauce is 74% fat, while the Greek-style yogurt JJ is using is only 2% fat.
I want you just to taste it.
Okay. When I first tried the Greek yogurt, it was disgusting.
Greek yogurt unflavored is not for everybody, but it is a good substitution for tartar.
Just the base. We're gonna experiment with a bunch of different tastes and we're gonna find a couple things that you like.
Substitution is good. This is the one part of the show that I'm not angry about.
Misty is ready to share her new sauce choices with her daughter.
This is real good. This
is the one positive thing about this show.
Yogurt and the spicy brown mustard.
That's why spices are really great in that they usually don't add calories. Some spices don't even have sodium content.
All right, guys, try prostating.
Movember is this thing that helps raise money and awareness for prostate cancer. Movember's a great organization. We're not growing mustaches. We're doing one better.
And it involves the finger.
Butt stuff!
Today we are gonna get our prostates examined.
At least they said finger. I remember watching the first episode of Grey's Anatomy.
I'm just gonna insert my fingers into your rectum.
Why fingers?
If it takes just one finger up the butt to find out a life or death situation, stick the whole hand up my butt.
Wait, what did you say?
Prostate cancer is the most commonly diagnosed cancer amongst men in the United States.
Very important to point out, while it's the most common cancer, it's also the cancer that many men die with, not of. So there's a huge majority of men over the age of 80 who actually have prostate cancer, but end up dying of other causes. So what we've come to realize and how we've changed our management with prostate cancer is, unless it's an aggressive form of prostate cancer or a treatable form of prostate cancer, we do a watchful waiting period where we monitor but don't actually treat. Because what we've come to realize is treatment and even diagnosis in some cases can be worse than just letting the disease be.
It rarely occurs in men under 50.
Oh, I don't actively think about being susceptible to cancer. It's not in my family. I'm a young person who can take on the world.
Testicular cancer is a cancer that the Try Guys need to worry about.
Okay, That was a weird scene, and I don't know if they did that for comedy. A doctor should never be palpating an area without visualizing it. Yes, you might be able to feel masses, but you might miss like a terrible rash. You might press on an area that's very tender.
Because testicular cancer is the most common cancer amongst men aged 20 to 40.
That's true, and actually testicular cancer has this like weird bimodal distribution where it peaks in younger men, kind of flattens out, and then also peaks in older men as well. The good part about it is it's rare. The second good part about it is quite treatable, even if it spreads.
So we're gonna do the genitourinary exam and examine your testicles to see if there's any abnormality, okay?
We're not just checking the testicles. We're checking the epididymis. We're checking the glands. We're checking for rashes. We're checking the pubis. We're checking the pubic hair.
The left one feels just fine.
Do I need to cough?
You don't need to cough. When people say to cough, what we're actually looking at is hernias, which are checked in the same area. And the reason we cough, by the way, is to raise intra-abdominal pressure so that when we are in the inguinal canal, if there is a hernia, we'll feel it poke and hit like the intestines or abdominal contents, poke our finger while we're in there.
Men that are age 25 to 40 have to get their nuts felt, and men that are age 50 or older have to get their butts poked.
That's basically right.
That's not basically right. We actually have moved away. The United States Preventive Service Task Force states that prostate exams are a shared decision-making process between a doctor and a patient, not something that is unequivocally recommended.
Eye on your side with your right side down. Bring your knees up a bit to expose your bottom, okay?
Bottom exposed.
Don't some people bend over?
Yeah, that can be done also. You can just stand up and lean over and put your elbows on the table.
Has anyone done like missionary style?
The doctor had us lay on our sides. Eugene, of course, bent over because he's Eugene.
I think it goes deeper when you do doggy style.
And he poured a ton of lube on that finger.
Actually, when we were med students, we would do this, and I remember the simulated patient that would actually be having it done to him multiple times over and over again would check our nails and had a nail clipper with him to actually decide should someone clip their nails before doing it, because apparently people have hurt him in the past.
Pressed his finger up against my delightful anus. Oh!
Just some pressure.
And then just went blah blah blah. It was in my butt. Oh my God. Oh my God.
And then he said, okay, we're going, and then boom.
And it's nice and smooth.
Great.
You're essentially checking for masses. You're doing like a sweeping motion because the prostate is at the bottom portion. If you feel any irregularities, if you feel enlargements, those are all potential abnormalities.
Everything feels fine, normal, smooth.
So that was efficient, super quick, very painless. Whoa, that was way deeper than I expected. Lubed up, in and out.
And you feel fine. All right.
Okay.
And here's some tissue if you need it.
I actually did a simulated prostate exam on a robot in the UK on live television. Here you go. So we have to do something called a digital rectal exam.
It's a finger up the bum, isn't it?
It's a finger up the bum.
What are we gonna be doing today?
Well, today we're going to be doing a little bit of electric stim on our gentleman right here. We're going to use it to simulate and mimic labor pains.
Do you think we'll die?
Once we can't handle any more pain, our safe word is epidural.
Childbirth is so painful that you would gladly have a needle stuck between the two vertebrae in your back.
It is a needle, and then usually a catheter is inserted over it in order to give a continuous line of medication. And the purpose is not for anesthesia, but for analgesia, to basically allow the patient to not feel terrible pain, but to still keep some sensation of their contractions, keep some ability to contract and push.
This will mimic a lot because it'll actually make the whole abdominal region contract.
In real childbirth, it's your full torso. It's your stomach, and it's your back.
And your uterus, so you can put it inside you.
You may not know this, but a great many women poop on the delivery table.
Because the act of pushing is very much like having a bowel movement.
That's very true, and that happens quite often. I think I've said it like so many times in my videos, and people still don't believe me. Epidural! Ironically, I feel like I've seen that happen in the hospital where patients said that they didn't want an epidural and then they changed their minds.
My wife had an emergency C-section with our first child, so I'm behind a curtain with my wife, and the doctors are doing their thing behind the curtain. They said, wait until we give you the cue to stand up. I thought I heard the cue, so I stood up.
And I'm gonna predict what he's gonna say. He's gonna say that the uterus is completely inverted and laying just on the belly, and he passes out.
And I looked, and what I saw was my wife's abdomen, cut open and clamped back. And on a table next to her, they'd taken out her intestines and her liver and all this stuff. They were in bowls on the
That's how they do C-section.
What? They did not remove his wife's liver. I promise they did not remove his wife's. Maybe it was the placenta or something, but.
This is Travis. This is one of Ned's best friends. They went to high school together.
So this is our high fidelity birth simulator.
Her name's Fidelity? High Fidelity.
So it's time. Let's do this.
All right, honey, I need you to push for me.
And as we're pushing.
9, 8.
All right, so this is going to be a lot of pain and pressure for the mother.
You're doing great.
Maybe
You're doing great, Travis.
Come on,
exactly.
push. Do it.
Oh, you're doing so good.
A lot of times it's nurses doing the coaching a lot better than the doctors, not gonna lie.
What do you mean help him? Well, there's nothing to do. What do I pet it?
Help spread the labia.
So basically what you want to do is you want to control the baby's head so it comes out very slowly and gradually, because the last thing you want is for it to come out real quick and then actually cause a tear in the vagina. So you want to control it and make sure it's coming out smoothly and help the baby rotate out so that there is no chance of the shoulder essentially getting caught and causing damage to the nerves that supply the arm.
Oh God, it's insane.
The baby's head's coming out.
Oh, it's like
there we go.
And at that point, you want to visualize that the umbilical cord is not wrapping around the baby's neck, because otherwise you want to remove it right away because it could actually choke the baby.
She's like screaming now, right? Like, how do I kind of just like diffuse the situation like emotionally?
Get the baby out.
Why are you tipping it away from the table? I want the table to catch the baby.
In real life, you're gonna have to catch the baby.
I have to catch a baby? Well, it doesn't shoot out.
The last part does shoot out. Because remember, there's a lot of force, and then once like the major areas like the shoulders and the hips are out, then the baby's kind of very slippery, so you want to be able to get a good grasp. Grabbing almost like by the back of the neck gives you a better support on the top, and then the second hand is on the bottom.
Gently push down, and then gently pull up.
So down.
So when you push down, you actually drop the shoulder below, and then you get the other shoulder up as well.
The baby's, oh, there we go.
No, that was a little too hard, sorry.
Widest part of the baby is out. There you go. Look at that. Whoa! You got it. See, look.
Don't catch it.
There you go. Perfect.
Here we go.
And right away, we do something called baby to breast, where we bring the baby. Once we make sure that the baby's APGAR scores are okay, we bring the baby to the mom, put it on mom's chest, allow the mom to spend some time with it, bond right away. We see better outcomes like that. Less stress for the baby as well.